will be here for some time and then
I know.
we'll have to leave for some time.
Yes.
Good evening, everyone. Chennai Menopause Society and Family Obstetric Gynecology Society jointly invite you for today's CME program. Today's CME on health aging series 4, Fit and Healthy. And we thank our guest of honor, Dr. Anita Shah and Dr. Sudha Sharma, and our chief guest is Professor Raja. Next slide. Next slide. Okay. This is our program. And to start our program with a prayer song, may I invite Dr. Shobna Magadevan, who is a consultant at Sitapati and Apollo Clinic and Apollo Hospitals. She is a member of OCOG and she is actively involved in many teaching programs and has special interest in pregnancy and sexual and reproductive medicines. Over to Shobna, madam.
Thank you, Deepa. I would like to start with an invocation song on Goddess Saraswati. மாணிக்க வீணைந்தும் மாதேவி கலைவாணி தேன் தமிழ் சொல்லெடுத்து பாட வந்தோம் அம்மா பாட வந்தோம் அம்மா பாட வந்தோம் வெள்ளை தாமரையில் வீற்றிருப்பாள் எங்கள் உள்ள கோயிலிலே உறைந்து நிற்பாள் கள்ளமில்லாமல் தொழும் அன்பருக்கே என்றும் அள்ளி அறிவை தரும் அன்னையும் நீ வாணி சரஸ்வதி மாதவி பாரதி வாகதீஸ்வரி மாலினி காணும் பொருளில் தோன்றும் கலைமணி வேண்டும் வரம் தரும் வேணி நான் முக நாயகி மோகன ரூபிணி நான் மறை போற்றும் தேவினி வானவர் கமுதே தேனருள் சிந்தும் கான மனோகரி கல்யாணி அருள்வாய் நீ இசை தரவானி இங்கு வருவாய் நீ லயம் தரும் வேணி அம்மா மாணிக்க வீணேந்தும் மாதேவி கலைவாணி தேன் தமிழ் சொல்லெடுத்து பாட வந்தோம் அம்மா பாட வந்தோம் அம்மா பாட வந்தோம்.
Beautiful, Shobna. Beautiful.
Thank you.
Shobna, super singer.
Thanks, Dr. Shobna.
Thank you, ma'am.
With the goddess blessing, next we'll move on to ritual light lamping. With this, next we'll move on to midlife prayer. That's me. I am Joint Secretary of the CMS. Next. We pray to God to give us a grace to accept the midlife physical changes and gently renew our strength. Guide our heart, our mind, and body to navigate the way and our trust in you to lead us safely through. We pray for midlife and mature women who cherish the fond moments of their life and also for those sitting in a doctor's office or who are in bed asking for healing touch. On this day, may all the midlife and menopausal women have the gift of joy, hope, and good health. Thank you, God, for the promise of hope you hold out to all midlife and menopausal women and inspire us to give this gift of hope to others. Thank you. Next, we move on to that short introduction. May I invite Dr. Rasiba to welcome us. She is our president of Chennai Menopausal Society, past president of Obstetric Gynec Society of South India, and past Indian Menopausal Society Education Committee chairperson, student member secretary, Savita University. She is interested in awareness programs, conducts awareness programs for Tamil Nadu paramedical staff, schools and colleges. She has many awards, lifetime achievement award from TN Dr. MGR University, Lifetime Achievement Award from Foxy 2015, Teachers Teacher Award, Stanley Medical College 2016, and the prestigious Dr. APJ Abdul Kalam Award in 2017, Best Scientist Award in 2018, Excellence Police Award from TN Medical Council received from Honorable Tamil Nadu Governor in 2018, Best Faculty Award 2020 to 2021, and she developed Midlife and Beyond app for an IMS, written text.
Unmute.
Yeah, very good evening to one and all. Respected Ambuja, President and Indian Menopause Society, Sudha, Secretary General, Indian Menopause Society. It's a moment of pleasure to welcome on behalf of Chennai Menopause Society and Tiruvannamalai OG Society to World Menopause Day celebration. Am I audible?
Yeah, you are audible.
Yes.
I'm extremely honored to welcome Dr. Ambuja. Menopause issues, menopause clinic, and awareness program is very close to her. I welcome you, madam. I welcome my friend. It's my privilege to welcome my Dr. Sudha, who is always supportive and encourages all our activities. It's a special moment of, it's a special welcome to my friend, Dr. Premilata, who is a well-renowned moderator, and her team. We have an excellent, eminent panelist to discuss about issues at 40. We welcome eminent speakers Hannah, Yalini, Gopinath, Dr. Meera, and actually we all know the financial status. If we are sound at 40, we can enjoy the later life. Similarly, we have to have a sound health at 40. I'm sure this panel discussion and the discussion by eminent speakers is going to give us a very valuable information about how to be fit at 40, both in health-wise and financial. And once again, I welcome one and all. Thank you.
Thank you, madam. Next, I invite Dr. Sudha Sharma, Secretary General IMS, to deliver her speech. Thank you, madam, for accepting our guest of honor. Over to Dr. Sudha Sharma, is the Secretary General IMS, Honorary Professor INA, Managing Committee Member, TCO Society of India, President Jammu Obstetric Gynec Society 2018 to 2020. She is a founder President Jammu Menopause Society, Editor-in-Chief of JMH Journal of Midlife Health, and a member of Editorial Board Journal of South Asian Federation of OBG, Editor-in-General.
Thank you, Dr. Deepa.
Thank you, ma'am.
Thank you so much, Dr. Deepa, for your kind introduction. So, a very good evening, dear friends, IMS family and friends, all the friends from Chennai Menopause Society and Tirumalaya OBG Society. Very dear Dr. Ambuja, I can see so many friends over here. Dr. Hepsi was so close. Dr. Sampa, Dr. Shanti, Dr. Premlata, Deepa, and Shobana. So first of all, a huge congratulations to dear Dr. Hepsiva and entire organizing team for celebrating World Menopause Month and choosing such important topics for discussion. You know, healthy aging. They say age is just a number. It's just a number, holds good for those who are healthy, not for those who are not healthy. We all know that aging is inevitable, but how to age, how healthier and graceful you grow is more important. And all would depend upon what you eat, how you interact, what is your psychosocial status, and so many other things. And choosing these important topics, nutrition, psychosocial problems, and the most interesting one which I found was financial stability. Dr. Hepzibah, you've done a great job by touching this aspect today in this discussion. And you have invited a galaxy of stars as speakers, chairpersons, moderators, and panels. So we are waiting to hear more from them, to learn more from them. All the very best for this, webinar, and a great thank you for inviting me over here. Thank you so much.
Thank you, Dr. Sudha, madam. Thank you so much. Next, we'll move on to our Chief Guest address. May I invite Professor Ambuja to deliver the Chief Guest address. She is the President, Indian Menopausal Society. She is a retired professor and HOD of Obstetric Gynae Department.
Deepa, thank you, Deepa. We'll go ahead.
Yes, please.
Again and again. Okay. Thank you. Thank you very much for inviting me. I feel it is an honor to come to Chennai. It is my second home. Always, I love to come to Chennai because of so many friends here. Everybody, you name anybody, they're all so close to me, not today, since years, I can say decades. And really, I congratulate multi-talented Hepzibah. And not in one. You take anything. You take computers, you take digital media, you take authoring something. And I think today I found a new thing that is an excellent, midlife poem. That's also really great. Hepzibah, you're great in innovating the things. And I thought it is only your brochures and roses. It's not like that. So many things you are innovating. Really, I congratulate not only Hepzibah, everybody. Tamil Selvi, Dhanalakshmi, Sampath Kumari, Shanti, and Drusha, you called Drusha. It's really great. Professor of Geriatrics, MMC. Yes, it is necessary. The second thing is choosing the topic. Healthy aging, always. It's a great thing. And September is the month of healthy aging. And today being, it is the Mental Health Day. These two are really important things because one thing is nutrition, second is the mental health. One of my friend who is a bank officer, she was telling, madam, I'm so stressed out doing this job. I said, okay, you relax, you take some off and be at home. She said, no, I can't do it because I want economic independence. That's what is the word she said. Why you are telling that your husband is a IAS officer? What is this? He said, no. Maybe anything it is. I want economic independence. And she says, but she said a lot of stress, even at home. Any lady in that matter, they have to work at home, take care of the husband, especially Indian wives and children, and workplace stress. That's another thing nowadays it has increased. You have to take care of your subordinates, superiors equally. So it's such a stressful life for a woman. Yes, today's topic, dealing about the psychological aspects. Chennai Menopause Society has selected such a wonderful topic. And I think Tiruvannamalai OBGYN also has joined. And great thing, Hepzibah, you made them to come into your purview because they were not coming out so easily. I know Tiruvannamalai University, from the time Dr. Vishwanath was professor and HOD there, he was all into yoga and all those things. But now I think all of them are coming out. It is a very great university, Tiruvannamalai University. And they also joined hands because of your presidentship, Hepzibah. It is so good. And today's topics is a really good one about the nutrition. And as Sudha said, it is the financial stability. You said, yes, that is the need of the hour. And lifestyle modifications is really important. And you are doing a very good job. And congratulations and all the best for your webinar. Thank you all again for inviting me to this Chennai Menopause Society webinar. Thank you very much.
Thank you so much, Ambuja madam.
Madam Ambuja madam, 1 minute. Deepa, 1 minute.
Yeah.
Ambuja madam, Tiruvannamalai, no. It is Annamalai University. It is in the same.
Oh,
What you told, still yoga and everything. This is Tiruvannamalai. No,
oh, both are different, is it?
Both are different.
Wow, I was thinking the same.
Annamalai is same with yoga.
Madam,
Yeah, that's Vishwanath is with yoga. Yeah.
temple is there, madam. You can visit. A big temple is there in
Temple.
Temple is there. Huge.
Where in Tiruvannamalai?
Yes, that is
Annamalai.
very.
Wow.
And they go on a particular day to go around. Tirivalam.
Full moon day.
Full moon day, they will go around.
Oh, okay. Next time when we come to Chennai, we will visit
Visit
Tiruvannamalai.
Tiruvannamalai.
Yes. Thank you.
Yeah, definitely. Thank you. Thank you for clarification.
You have to join another webinar. Thank you so much, Dr. Ambuja madam and Sudama. Thank you so much.
Thank you very much.
Thank you.
Sorry for leaving, but feeling sad that we are not able to hear such a good CME.
Yeah, we really wanted to,
Yeah, I
listen
wanted to
all
join,
these.
but there it is an inevitable thing. We are leaving. Very sorry. But again, I think we will not leave you again. We'll have it again.
Yes, madam. On 25th.
Okay.
Thank you. Thank you, Hepzibah.
And bye, Dr.
Namaste
Anita.
to all of you.
Bye.
Hi, Sudha. Hi, Ambuja madam.
Anita.
Wow. Hello, Anita.
Hi, madam.
How are you, dear?
Bus fine, madam. Sorry, a little bit late joining.
No problem.
Yeah.
We, all of us are in the same family, no? Little bit this side or that side, doesn't matter.
Right.
Yeah, it is
Dr.
your time
Anita
now.
Shah,
Yes.
welcome, madam. It's me, Dr. Deepa. I may invite Dr. Anita Shah, madam, is the past Secretary General for IMS to deliver her guest of honor speech, madam. Please.
Yeah. Thank you very much, dear Dr. Hepzibah and Team Chennai Menopause Society for inviting me over here and giving me the opportunity to be over here. We are celebrating October as a month of menopause, and just we want to increase awareness regarding all perimenopausal, menopausal and postmenopausal women. So this is the very good platform to encourage everything regarding healthy aging. We all know very well that if wealth is lost, nothing is lost. But if health is lost, something is definitely lost. And so we have to remain fit throughout the life. You all know about the slogan of Indian Menopause Society, that fit at 40, strong at 60 and independent at 80. And during our tenure of the last year, we just elaborate that slogan to fit at 40, fancy at 50, strong at 60, sexy at 70, independent at 80, naughty at 90, and healthy at 100. So definitely all of us have to remain healthy till the age of 100. And we want that our patients, our relatives, our elderly persons in the family, they should also remain same. Just we want to remain everyone as fit. So again, thank you very much. I won't waste much of the time. The webinar will give a lot many carry-on messages. So thanks a lot again and again. Thank you.
Thank you.
Thank you, madam. With this, next we'll move on to our scientific sessions. We have 3 sessions. For the session 1, may invite our chairpersons, Dr. Sambat Kumari and Dr. Usha. Sambat Kumari, madam.
Yes, we will proceed. Deepa, no problem. Introduce Usha, that's all.
Okay. So, okay, madam. Sambat Kumari, madam, will introduce the speakers. Dr. Usha. Okay. So, Dr.
So first we will go with nutrition. Good evening to all. First of all, I thank Dr. Hepzibah madam and the team for the wonderful opportunity. Now we'll go to the first session. The first talk is by Dr. Praveen, Mrs. Hannah Praveen, Nutrition at Midlife. She is a BSc Nutrition and Dietetics, graduated in BMLT in CMC Vellore, diabetic educator course in CMC Vellore. Her experiences with worked as a graduate medical lab technician in CMC Vellore for 3 years and working as senior lab in charge for the past 23 years in diabetic educator for past 7 years in Rajam Nursing Home, Tiruvannamalai. Back to Mrs. Hannah Praveen. Irkangla? Yes, yes, madam.
Good evening, ma'am. Good evening to everyone. I am Mrs. Hannah Praveen. You gave me a good introduction about me. So I'm going to talk about women's nutrition and metabolism needs after 40. Can I go to the topic, ma'am?
Yes, you can go.
Am I audible?
Yes, yes, you are audible.
Yes, ma'am. Can you see my PPT, ma'am?
No, no.
Chitrakala.
Yes, ma'am. Shall I flash, ma'am?
Dr. Hannah, Chitrakala will.
Do you have her presentation?
Yes, ma'am. I have her presentation.
Then you can present, I think. You confirm with Hannah.
Hannah, ma'am, is my screen seen?
Women's nutrition and metabolism after 40. Tiku.
I think so, ma'am is.
Yes, she has started. Chitrakala,
Okay, ma'am. Okay, ma'am.
Can I start, ma'am?
Yes, yes. Hannah, you can start.
They say 40 is the new 30 with healthier habits. So after 40, we feel little tired, but they say it is a new 30. Yet women continue to struggle with weight and other medical concerns as they enter 40. So both nutritional needs and metabolism change at this age. So our metabolism gets slower. Women lose about half a pound of muscle per year starting around the age of 40. That makes losing weight even more difficult. So our activity also slows down during this age. So it is very difficult for us to lose weight. So some of these changes women experience are due to decreased hormones, reduced activity level, and the medical conditions. So to overcome the difficulties and struggle in the health at the age of 40, I'll share few points about nutrition and metabolism. So that I have taken into 3 points: path to improve wellness, nutrition, and
video
first thing is path to improve wellness. So what we eat is even more important as you enter into 40s. So women need, in first 2 decades, we need more protein as we grow. And second 2 decades, we need more carbohydrates as we are very active during that period. And the third period, again, we need less of carbohydrates and more of proteins. So let me list out the food sources from where we get our food. So first, protein. We get protein from lean meat, chicken, seafoods, egg, beans, peas, and nuts, and low fat dairy products like milk, yogurt, cheese, and fortified soap products. And carbohydrates we get from whole grains, fruits, vegetables, and legumes. And fat, healthy oils, we can use olive oil, wood pressed groundnut oil, and canola oil. And the vitamins we need at the age of after 40 is mainly B12 and vitamin D. That we get from vitamin B12, we get from egg, lean meat, fish, and dairy products. And vitamin D from oily fish, red meat, liver, egg yolk, and cereals. So vitamin D is after 40, many of us may become diabetic or hypertensive. So for vitamin D, the food source what I have given, we can take once in a while. So next thing is the minerals. What we need after 40 is calcium and magnesium. So calcium we get from milk, cheese, yogurt, and green leafy vegetables. Magnesium from greens, nuts, seeds, and whole grains. These foods, what I have mentioned above, have been linked with some diseases disease prevention such as osteoporosis, high BP, heart disease, diabetes, and certain cancers. Because after 40, we women face all these difficulties in life. So next thing, I'm talking about the nutrition for women after 40. So how to plan the diet? So choose a variety of vegetables including dark green, red and orange vegetables, beans and peas, starchy and non-starchy. So here what the vegetables I mean is the vegetables which grow above the ground will be very healthy and we will not gain weight. So we can choose that kind of vegetables. And variety of fruits here also, avoid high calorie fruits like avocado, fig, dates, banana and all. Rest of the fruits we can have. So include grains in your daily diet. For grains, for example, you can add corn, oats, barley. So in a daily diet, you can add one of the grains. Then stick to fat-free or low-fat dairy products. That is available in markets nowadays. So we can stick on to that. So next thing, have protein at every meal. So all the meals, you make sure that you have a protein in your diet. So use, as already I have mentioned, use healthy oil, olive oil, wood pressed oil, groundnut oil, canola oil. So foods to be avoided over 40 years. Artificial sweetness we have to avoid, like saccharin and all the artificial drinks we have to avoid. Artificial proteins we have to avoid, and vegetable oil which is made out of soya bean or sunflower, that we have to avoid. Margarine, the dalda, that products we have to avoid. Salad dressing, because salad dressing may contain more of butter, cheese, and that will make us to put on weight. So avoid salad dressing and canned foods. So next thing, I talk about the metabolism. So after 40 years, our hormone levels, estrogen drops, and this causes our insulin to raise and our thyroid level also goes down. So this combination will make us more hungrier and we end up in eating more, and we cannot burn the calories as we cannot burn calories because we cannot be active as we were in 30. So it will be very difficult for us to burn the calories, and we will end up in putting weight, and that too around our belly. So to avoid this weight gain, eat fiber rich foods like whole grains, nuts, berries to fill you up and help you to eat less. So next thing, I'm going to talk about tips to lose weight faster. So eat a high protein breakfast. So if you eat a high protein breakfast, you will not gain more of calories, so you can lose weight. Avoid sugary drinks and fruit juices. So all the sugary drinks I already mentioned, like Coca-Cola, Limca and all, and so avoid that, and drink water before meals. So if you take water before meals, that will be helpful for you to take. You can reduce the amount of food you take, so you will not end up in weight gain. So choose weight loss friendly foods. So that I mean the vegetables and fruits you can take, and eat soluble fibers. So this soluble fibers, that is, it completely breaks down by the digestive system. So we can take that oats, peas, beans, apples, citrus fruits, barley and all. So you take that kind of food in your diet. So drink coffee or tea. Don't take any cocoa drinks. All that will lead to weight gain. So base your diet on whole foods. Whole foods is the food that is not processed or it is minimally processed. Whole grains, legumes, fresh fruits and vegetables. And the next thing is eat slowly. So all of us in this fast world, we just hurry up and we eat very fast. So that should be avoided, and eat slowly so that you will not gain weight. And next final thing is follow 3 meals and 2 snack pattern. So this is as I've done diabetic educator course in CMC. They taught me that 3 meals, 3 snack pattern is best for a diabetic patient. Here I have given follow 3 meals and 2 snack pattern for women who's above 40 years. So I have given a timings to follow this 3 meals and 2 snack pattern. So morning 6 to 6:30 a.m. coffee or tea, and take little amount of fat-free, low-fat milk, add with coffee or tea. So for about 8 to 8:30 a.m. you take your breakfast that must be protein rich. 10:30 to 11 a.m. a mid-morning snack that can be a legume sundal or ragi porridge or the diet biscuits, the Mari biscuits, or sometimes if you're very thirsty, you can have 2 cups of buttermilk like that. So 1 to 1:30, you can have your lunch. See, the mid-morning snack will help you not feel more hungry at lunchtime. So if you take a mid-morning snack, that will be very useful. So to lunch, you take 1 cup of rice and you prefer 2 cups of vegetables. So that will be helpful for you to reduce your weight, and also you will feel healthy. And by evening 3:30 to 4 p.m. you take an evening snack, which the food you can take is what I said at 11 a.m. You can just follow in the evening also, and you take coffee by 5 p.m. Don't take snack and coffee together in the evening. You can give a break and take, and 7 to 7:30 dinner, or you can take your dinner 2 hours before going to bed. So that will help you to reduce your weight and you will not put on weight. So for dinner, you can take wheat chapatis or dosa or millet dosa, and you take vegetables and proteins also. So, and if you feel hungry or before going to bed, you can have a cup of milk at 10 p.m. and then you can go to sleep. If you're diabetic, don't add sugar. If you're non-diabetic, you can add sugar. So next thing is, I'm going to talk about the exercise. Exercise is any movement that makes our muscles to work and requires to burn calories. So the topic is how we can be fit at the age of 40. So we can do only mild to moderate exercise. So being active has many health benefits, both physically and mentally. So do moderate aerobic exercise 30 minutes a day, brisk walking 30 minutes a day. So this walking, everybody will not have time, or we will feel difficult to walk every day. So I'll just teach you how you can walk, how you can start walking. You just start with 15 minutes. The first 5 minutes, you give a slow walk. Gradually, you increase your speed. And the next 5 minutes, you can walk briskly. And the third 5 minutes, you can slow down your walk. So this will help you. You will not have any knee pain, and you will have a tendency to walk next day. So you slowly start with 15 minutes and then you can increase to 30 minutes a day. So 5 days per week is also enough, and this will keep you healthy and fit. So benefits of aerobic exercise I've given. I've shared some images also. So this simple exercise will help us not to gain much weight. So this will, the benefits of aerobic exercises, so improves cardiovascular conditioning, decreases risk of heart rate, lowers the blood pressure, increases the HDL or the good cholesterol, help to better the control of blood sugar, assist in weight management or weight loss, improves lung function, and decreases resting heart rate. So finally, ma'am, I conclude my speech by saying what things you have to consider after 40 if you gain weight, or if you have any health issues like diabetes or heart disease or BP, you have to get the advice of your doctor. Hope my speech is useful to you all. Thank you very much for giving me this opportunity. Thank you, ma'am. Be fit, be healthy, be happy. Thank you all.
Thank you, Hannah. Wonderful talk you gave. So you should be happy with whatever we have. That is the final conclusion. Okay, thank you. Dr. Usha? You can stop sharing, I think.
Yes, ma'am.
If any doubts, we can see in the chat box. Deepa, Dr. Usha irukangla? Hello?
Madam, Usha, madam.
Illa,
I don't think you can call the next speaker, madam.
idu potra, CV potra.
Yes.
So now we had a good talk about the nutrition and exercise. Then we have the talk of psychological problems at midlife by Miss Yarini. She is a clinical psychologist, Upper Mental Health Facility, Tiruvannamalai Health Center. Back to Miss Yarini.
Yeah, hi ma'am, good evening.
Yes.
Am I audible?
Yes, you are audible.
Yeah. Good evening, ma'am, and good evening to one and all who is attending this program. I'm very happy to have a talk in this, especially midlife women's. I'm very happy to talk a few things about women's health. That is physical health. Yearly, ma'am, nutrition, ma'am, has given a wonderful points and which is very, very helpful for us. But right now, here we are going to talk about mental health. And my topic is mental problems in midlife. So I don't want to talk about any problems. Here, I think everybody is viewing my slide, right? Is it viewable to everyone?
Yarini, you can proceed.
Yeah, ma'am. Yeah, okay. So
Slide
here,
is visible.
yeah, here I have given a topic, promoting innermost existence. So you may all having a doubt like what is that promoting innermost existence. So and here I'm here to prompting you to promote your innermost existence. So innermost existence is a thing like how we are handling our own psychology. So as you all coming across 40, 45 and we are crossing the midlife. So what are all the things we have to follow and what we have to drop? So that is what main thing today I'm going to talk about. Let me move on to next slide. Yeah, here I have given you two things. One is life versus life. So what does it mean? Life, you all know. That is what the life, what we are come across these many years. Like life is a thing where we are living with all the efforts and what you have suffered or what you have taken as steps to achieve so many goals. So here you all lady superstars. So whoever I'm talking with and whoever being attending this program, everybody is a lady superstars. That right now we all want to think a few minutes regarding this is a time where we are going to step into a nature from a narrow path. So till this time, we all were moving with so many we are having so many achievements, goal to achieve this, that, and it has been started from our childhood. So after our schooling, we have to get our medical seat. After completing the medical, so how you are going to promote your field, how you are going to be a good professionalist. So these are all the tasks what we have followed till now. So right now, to whomever I am speaking with, they all lady superstars who have been achieved and who have been shining in your own field. So after this, what we are going to do? So actually, the thing is whenever we are achieving a point, whenever we are achieving a goal, so this is what my goal, this is what my vision, this is what my destiny, this is what always we are running with. So here we want to look about what is life and what is life. Life is a thing lively. So we have to be in the moment. Life is all our responsibilities, what we had, what we are going to carry out, and what we had in your life and what we are going to proceed. So this is what life is life. So we have to choose here life. I think almost all has been come across, and right now this is a time to think about life. So shall we move on to next slide? Obsession. So you may all very familiar with the word obsession. Like everybody has been obsessed. So here I have given few words about obsession. Obsessed with success. So first thing, what we are always obsessed with, we want to succeed. So once if we go with the exam, we want to success in my exam. Again, after getting the success in our exams, and next, what is our obsession? So I want to get settled with my profession. That is what the obsession we are having. So again, like after settling in the profession, so we have to purchase the things or whatever. So we are not settling with whatever the goal or whatever the destiny we had. Once if we get settled, then obsession will not be there. So as we all obsessed with so many things, always we are obsessed. So this is what the meaning of obsession in our life. So obsession means we are always thinking about something which is our own thoughts. Even though it is our own thought, we know which is not necessary right now, but still it will disturb us. That is what the obsession. But obsession is very good for our success. But right now, this is not a place to carry out with the obsessive thoughts. Shall we move on to next slide? Yeah. Obsession with mindfulness. So this is what the next hint I'm going to give you about our mental health. So see here, as I told you from earlier slide, like we are obsessed with one or other throughout the lifetime. So right now we reached midlife. So this is here. So after getting success with our goal, or after getting success with our destiny, like this is what my goal, this is what the thing I'm going to achieve. After getting the achievement or after that success point, what we are doing? Again, we are fixing some other goals and we are running behind that. So once always we are fixing a goal and we are running behind some one or the other thing. That is what my slide is showing here. See here, become obsessed with something. And what is another side? So do we want to be obsessed with one or the other goal? So as we are in midlife, so let us decide whether we need to be obsessed or want to be mindfulness. Again, while talking about mindfulness, what is mindfulness? Being in the presence. So as we all achieved success and we are in a position like what we want to achieve, everything settlement, like family wise we got settled, profession wise we got settled, and as right now we are in middle age, we want to think about mindfulness. We have to be kind, we have to be in presence, we have to be in sense, and what are the things happening in and around us. We want to be very mindfulness, and we want to be more aware about our own health as well as about our psychology. So once if we are mindfulness and being aware of what we are thinking, what we are doing, what we are obsessed with. Even earlier we might be doing like we are obsessed with, yeah, I have a responsibility, I have to run behind it, I have to go finish all my tasks, obviously. So these all we can taken to an account till prior, like till before mid age. As we are in mid age right now, we have to take about our own mental health. That is what more important. So once if you want to take care of our mental health, as like earlier nutrition ma'am has told about like what are all the foods we have to take, we should not take. Same as like our body organs, even our mind and our brain too has some a kind of a thing like what we have to think about and what we should not follow. Same thing. So as like diarrhea happening in our digestive system, even for our brain there is a diarrhea. That's what excessive thinking, negative thoughts while thinking about something about our future or our past. So whatever we are thinking about, obviously which is not good for our mental health. Once if you are being in live, once if you are being in mindfulness and being in a presence, what's happening right now, what I'm going to do, where I'm stepping, what I'm doing, what I'm eating, and what I'm speaking with other person. So everything while you are doing in a present, that is life is live. So once if you are being in live, if you are not obsessed, being in mindfulness, being aware about what you're doing, what you're stepping in, what you're thinking, what you're going to do, everything you're doing in full awareness, your mental health will be in a protective way. So this is what obsession with mindfulness. Shall we move on to next slide? Next slide. Yeah. So as we have talk about obsession right now, let me try to include Maslow's hierarchy of needs. So this is what our major need, and here I'm going to talk about a theory. So here you people have to decide where you are. So here basic need is our psychological needs, biological need, then our safety needs. So like what is biological need, psychological needs. So these all we got getting satisfied, and also safety needs like house. So whatever the like clothing, everything. So our basic needs are getting satisfied. Then we are moving to psychological need, that is social needs, self-esteem. So these two plays a major role in psychological needs. So what is social needs and self-esteem? Like already I have told that whomever I'm talking with, everybody is a lady superstars who has been achieved a lot, and who has been proven like they are like best in their own professions. So what I feel like basic needs and psychological needs has been satisfied during this mid period. So once if we get satisfied with this level, then we have to move on to self actualization. That's what mindfulness. So as I told earlier, as we are obsessed about our responsibilities, our growth, our profession need, whatever the like whole thing we are handling in our life. So everything has got settled in this psychological needs. So right now, this is a place to move on to the self fulfillment, that is self actualization. So only if these things getting settled, once if you have to get keep full stop to your obsessed responsibilities, or obsessed with some one or the other thing, are obsessed with something, then we are moving to next step, that is self-actualization. Once if you achieved your self-actualization, there comes a original growth of your own psychology. And once if you achieve this own psychology, once if you achieve this own growth within you, there comes a topic like promoting your inner existence. So you have to realize like where you are standing in this hierarchy. So from here, once if you understand like, yeah, I have achieved this biological needs, I got satisfied, and psychological needs, I got satisfied. Here you have to bring that acceptance, and you want to move on to the next stage. So obviously once if you come once if we are comparing ourselves, or while seeing the world materialistically, we are not getting satisfied. So the technology is growing, and however we are earning, it's which is not at all getting satisfied. So once if we get satisfied, then we are moving to the next stage, that is self actualization. So that is what the growth, that is what the original growth we are feeling from our innermost existence. So once if we get deficiency with this area, that is basic needs or in psychological needs, definitely nobody is going to achieve the self actualization. So here you have to be more clear. Only once if you get satisfied with your basic needs, then you can move on to the psychological needs. Then you are going to achieve your original growth, that is inner growth. So right now, this is a time to think where you are lagging and where you are standing. Once if you realize that, definitely you are going to move on to the self-actualization state, which is really a wonderful thing. Shall we move on to next slide? So here we are going to synchronize ourselves with nature. So what are we doing? So as we have seen that hierarchy needs of Maslow's. So here from here you have to understand which stage you are in, whether you are in basic need or in psychological need, or if you achieve these both, you have to move on to the self-actualization. So for that self-actualization, what are all the things you have to do? You have to synchronize yourself with the nature. So you right now, like what do you mean by nature? How I want to synchronize myself with the nature, how I want to be mindful, how I want to be aware of all those things. These are all the questions you might be having from the whole slides what we have come across, and what I have given you a few like information about all the slides. So right now let us have a connection with all the slides. Life versus life. So life you have got completed, and you achieved your all responsibilities. So you want to be live. So live means how I want to be live. So whatever the thing you are doing, you want to do with your full heartedly and without having any preoccupation or thinking about future or thinking about past. Be in the presence. And next thing, obsessions with mindfulness. So for being in mindfulness, which is not at all easiest or very easily handling thing, like it's not think it will come within a day or within a week or within a month. You have to be in a regular practice to be in mindfulness. So once if you are walking through the forest, or if you people are being in mindfulness state or being in presence or being in alive, so while you are walking, from your walk, from your breeze, what you are getting, from the smell what you are feeling, and the sound what you are hearing, from everywhere you can understand that that is what the nature. For that you don't want to go to the forest. Why even being in your home and sitting inside your own room or wherever you are sitting, sit there, close your eyes and be mindfulness for few minutes. That time you are realize that this is what a mindfulness. So if you all ready, let me have a mindfulness breathing session. It will take around 2 to 3 minutes. Just follow my instructions. So this is a mindfulness exercises. So once if you follow it in everyday basis, like from morning and evening, whenever you are getting time, you don't want to spend a special time or special place for this mindfulness exercise. Wherever you are, even while you are practicing in your clinic, when like while you are seeing the patients, you can take a break for a few minutes and close your eyes and you can do this exercise. Shall I continue with my exercise? Are you ready to follow?
Yes.
Yeah, please.
Yes.
Yeah, thank you so much. Please close your eyes. Everyone, please close your eyes wherever you are sitting, whatever the comfortable position you are having, and whatever the work you are in. Nothing is important here right now. Wherever you are sitting, you just make yourself more comfortable. Close your eyes. Just watch your breath. Simply watch your breath and feel how you are inhaling, like how you are taking in the breath, and while you are releasing your breath, how the breath is coming out through your nose. Feel the sense, like how while it's getting in, like entrance of it. I'll continue in Tamil. I think it will be more better. கண்ணை மூடிட்டு நீங்க மூக்கு வழியா இழுக்கும் பொழுது அந்த சுவாசத்துடைய வார்ம்த், அதாவது வெளியில இருந்து ஒரு காற்று, ஒரு லைக் ஆன்டிபாடி, சம்திங் இஸ் கெட்டிங் இன்டு யுவர் பாடி த்ரூ யுவர் நோஸ். அதை நீங்க ஃபீல் பண்ணுங்க. ஏதோ ஒண்ணு வந்துட்டு மூக்கு வழியா நமக்கு உள்ள போகுது. அதே மாதிரியே வெளியில வரும்பொழுது அந்த ஒரு வார்ம்த் இருக்கும், ஒரு பிளசன்ட் வார்ம்த் இருக்கும். அதை அந்த நோஸ்ல ஃபீல் பண்ணுங்க. So from our birth till now we are doing it. Breathing. Inhale பண்றோம், exhale பண்றோம். ரொம்ப ஸ்ட்ரெயின் பண்ணி இன்ஹேல் பண்ண வேண்டாம், எக்ஸேலும் ஸ்ட்ரெயின் பண்ணி பண்ண வேண்டாம். Let it be normal, as like everyday life, as like every second, every moment how you are breathing. Just you are going to watch how the air is getting in and getting out. Good. Now, while you are breathing in, you are going to feel how the air is getting into your lungs. அந்த மூச்சு காத்து இழுக்கும் பொழுது உங்க லங்ஸ்குள்ள அந்த காத்து எப்படி போகுது, அப்போ போகும்போது நம்மளுடைய லங் எக்ஸ்டெண்ட் ஆகிறத ஃபீல் பண்ணுங்க. திரும்ப அந்த உள்ள போகும்பொழுது உள்ள கிடைக்கக்கூடிய அந்த ஃபீல் பண்ணுங்க. திரும்ப எக்ஸேல். while you are exhaling your air, how the lung is getting shrink. சுருங்குறதையும் கவனிங்க. So breathe in, breathe out, flow ஆயிருக்கு. அதுல ஃபர்ஸ்ட் வந்து நம்ம நோஸோடைய அந்த வாய்ப்புறத்துல அந்த வார்ம்த் ஃபீல் பண்றோம். வெளியிலேந்து போகும்போது எவ்வளவு சில்லா போகுது, திரும்ப உள்ள இருந்து நம்ம பாடியில இருந்து வெளியில வரும்போது என்ன ஒரு வார்ம்த் கொடுக்குது. நெக்ஸ்ட் ஸ்டெப், உள்ள போற ஏர் நம்ம லங்ல போயிட்டு லங் எப்படி எக்ஸ்பேண்ட் ஆகுது, அகைன் ஹவு இட் இஸ் ஷ்ரிங்கிங். ஜஸ்ட் நீங்க பிளசண்டா வாட்ச் பண்றீங்க, உங்க பிரீத்தை மட்டும் தான் வாட்ச் பண்றீங்க, நத்திங் எல்ஸ் யூ ஆர் டூயிங். நவ் யூ ஆர் கோயிங் டு ஃபீல் யுவர் ஹோல் பாடி. உங்களுடைய பாடி ஃபுல்லாவே ரொம்ப லைட்டா ஃபீல் பண்றீங்க. அண்ட் ஃபீல் த சவுண்ட்ஸ் அரவுண்ட் யூ. ஃபீல், just feel and watch, don't concentrate. Just feel the sounds around you, just feel the sense. அந்த ஒரு சில்னஸ் ஆகட்டும், இல்ல வார்ம்த் ஆகட்டும், ஒரு மைல்டு பிரீத் ஆகட்டும், இருக்கக்கூடிய சத்தத்தை கேட்கலாம். உங்க பிரெயின் என்ன வேணாலும் யோசிக்கட்டும், டோன்ட் கண்ட்ரோல் இட். வாட் எவர் த தாட் கம்ஸ், லெட் இட் கம். வாட் எவர் யூ ஆர் திங்கிங், லெட் இட் திங்க். நோ இஷ்யூஸ். யூ டோன்ட் வாண்ட் டு லுக் இன்டு எனிதிங். Let it be cool. So right now you are doing just watching your breath, just watching the things around you, just feeling how the chillness or the warmth or the breeze is disturbing your skin and the sounds around you. Just watching it. Now take a deep breath. Exhale slowly. Inhale, exhale, relax, relax yourself. Slowly open your eyes. This is what mindfulness. Mindfulness is nothing, just being in presence. ஒண்ணுமே கிடையாது. நம்ம வந்து பிறந்ததுல இருந்து we are breathing. Once the breath stops, we are another thing. So as we all know, அந்த பிறந்ததுல இருந்து எந்த ஒரு சுவாசத்தை நம்ம இழுத்துட்டு இருக்கோமோ அது என்ன பண்ணுதுன்றத till now we haven't watched. So அந்த சுவாசத்தை நம்ம கவனிக்கிறதுக்கு, மைண்ட்ஃபுல்லா லிசன் பண்றதுக்கு we are taking few minutes. So during that time, main thing, you should not control your thought. Main thing, you should not focus yourself into anything. Just you are watching in and around you. That's it. This is what mindfulness. Just only few minutes will take to follow these steps. This is really good for your brain and good for your psychology. So once if you are doing that thrice a day, you come to know like what is nature and what is narrow path what we are going. கண்ண மூடிட்டு நம்மளே டிசைட் பண்ணி போய் this is what happening outside, this is what going to happen, and this is what going to be happen, this happened like this. So அந்த மாதிரி we are deciding everything. We are predicting the things is happening like this. நம்ம நினைச்ச மாதிரி நடக்கலனா we are getting upset. These all things happening only on because of our thoughts and what we are perceiving things in a way how we want. This is the main reason. So once if you are being in a mindfulness state, definitely we'll be having a good mental health. So shall we move on to next slide? Actually, I'm not seeing slide. Yeah. So this is what we are going to follow. So promoting your innermost existence. How? First, being alive. Being alive means like, yeah, we are living, but being alive, how I have told you, being mindfulness. And while you are being mindfulness, definitely yourself is going to be more aware and your inner growth is going to happen. So once if these all things happen in a order, definitely your innermost existence will blossom like a flower. So this is a open talk time. If anybody has any doubt regarding this, you can ask me right now. Thank you.
Thank you, Hannah. Usha madam?
Yes, ma'am. Sorry for joining a bit late.
You want to conclude? Yeah. Do you want to say anything, madam?
Yeah. Very happy to be a part of this program. As we all know, healthy and active aging, the preparedness should start early. Should start as early as 40. So excellent lectures by both the speakers on nutrition and psychological problems. Psychological problems, we all know, with the hormonal changes and because of life situations at that age, many of them may have a lot of psychological problems. She has given a very good idea about what is mindfulness. I think all of us can start practicing the same. I thank both the speakers for their excellent presentation.
Thank you, ma'am. Thank you so much. So if anybody has any queries, you can contact me even personally, or else however you want. Even if you have any questions, you can raise a question in the chat box. I'm ready to answer.
That's fine.
Dr. Hannah.
Chat box, they can put any doubts, they can put in the chat box, I think.
Yeah.
Okay. Fantastic, yeah.
Thank you, ma'am. Thank you so much. Bye, ma'am.
Thank you.
Thanks, Sampat madam and Usha madam. We'll move on to the next session. Next is on discussions, panel discussion on midlife issues. To moderate the session, may invite Dr. Premlata madam. She is a consultant head of the department, Meta Multi-Specialty Hospital. She is formerly a professor of OBG and director of Institute of Obstetric Gynecology. And her panels are Dr. Batma and Dr. Gita. Dr. Alamelo and Dr. Raja is requested her to join. So next, I may ask Dr. Shanti madam to join as a panelist here. Shanti madam. Yes, ma'am. Okay. Over to Patma. Over to Premlata madam. Kindly introduce the panelist, madam.
Okay. Good evening to everybody. At the outset, I'm really happy to be associated with this seminar. Actually, I'm thankful to Dr. Epsiba for wonderful talk I've heard on nutrition and another thing, psychological thing. I'm now with a midlife. I'm going to talk about midlife issues, and with me are three panelists. Dr. Batma, she has come from. She's a private practitioner and she's a fitness medicine practitioner, and is an apt person who is to talk about all about menopausal midlife crisis issues. She has graduated from Tirunelveli Medical College, and right now she is the treasurer of Chennai Menopause Society. Welcome, Dr. Batma. Next, Dr. Gita Raja. She has graduated from Tanjore Medical College. She has a PG diploma in ultrasonogram, and she has been having a certificate in diabetology from Annamalai University, and she is a very active EC member of Chennai Menopause Society, and she is very much interested in women and diabetes healthcare clinic and all the metabolic syndromes. I welcome Dr. Gita. Next, all of a sudden, in a few minutes' notice, I will call for Dr. T.K. Shanti, my best friend, to be one of the panelists, because I could not get Dr. Alamele and Dr. Radha. Last minute, they were not able to join. And we all know T.K. Shanti was a very great academician, and she's retired as a director from IOG. She was a former HOD of Kilpack Medical College, and she was a past president of Oxy. Say a lot of credit to her. She's a recipient of A.L. Mudalia Traveling Fellowship, master trainer of CMANG, and she has an expertise in tubal microsurgery, and she's an innovative speaker in many national and international state level conference. I welcome Dr. Shanti Gurase. Okay, for the panel. Can I share my screen now?
Yes, ma'am.
So at the outset, okay, we all know midlife. Midlife refers to middle years of life, or middle age, and approximately between 40 to 65 years. The mean age of menopause in India is around 46 years, and it's lower than that of Caucasians. And middle age is a very long period, and it is actually a very critical period, because during this middle age, whatever psychological or physical changes that have lasting effect on the later or the older age. So one should be able to have healthy. So far we have discussion about all the new fit at 40. So during the middle life, one should be physically active and healthy, and psychological changes all begin here, and one should be able to overcome this. So when we say perimenopause, we all know the perimenopause is the period where from the starting of menopausal transition changes to the period of approaching just beyond the menopause. So when you have the straw classification staging, we all know about the staging. Regarding the final menstrual period, we have 3 stages. Actually, the menopausal transition period, reproductive period, and postmenopausal period. And what we are very much worried about, where we have to catch them, is the menopausal transition period and the immediate postmenopausal period, during which time lot of changes occur. And once we catch them at that period, the later ages, actually later older age, are found to be more healthy. So another classification or staging of menopause by Angles area. In the previous classification, star classification, it was mainly dependent upon the increased FSH and low estradiol. So in the late reproductive age group, there is increased FSH. In the menopausal transition period, there will be irregular menstrual cycles and increased FSH, and the immediate postmenopausal increased FSH was criteria. Whereas Angles area was talking only about grading the menopause in 3 stages, like stage 1, where you have the prior to the menopause, that the early and late stage of menopausal transition. Stage 2 is up to 5 years after menopause, and late is stage 3. Why we are worried about these stages? Because the stage 2 is where is the window of opportunity, during which time when we catch the women, we'll be able to have a lot of menopausal health. So going to the case history, 39 years old, school teacher teaching biology. She attends clinic with complaints of increased fatigue, insomnia, and irritability. She's worried about recent mild increase in weight, irregular menstrual cycles, and going for menopause. So her menstrual cycles are frequent now, advanced by 6 to 8 days for the past 6 months. Prior to that, her cycles were regular. So how do we proceed?
We need to first look into which stage of menopause she is. Here she is in early menopause transition phase. We have to do some basic investigations regarding complete blood count, if she is anemic, check for the thyroids, and also ask her the symptoms. Does she have her sleeps properly? Does she have any hot flushes? And any aches and pains in the bones? All these are to be asked. And her sleep patterns and all those things. And if she's got any episode of mild low mood, all those things can add to the point, and from then on we can take her up.
So she has increased fatigue, insomnia, irritability, and in the history taking, what all other things, when your examination, what all other things you would like to look into?
We can ask like how her mother had attained menopause. Was this the same age, or and also her family history also can also help her. Have the children gone away and she feels that emptiness, and is she taking care of her elderly parents, or how is the relationship with their spouse, and what is her medical, does she have any health issues per se, like diabetes or hypertension or anything else that also needs to be.
So here is a biology teacher who is telling about increased irritability, and she's worried about increase in weight. She's around 40 years, she's 39 years. So we'll assess her a whole, what is her BMI, waist circumference. You have to calculate her individual risk factor, whether she's a prone, whether family history of diabetes, hypertension, all these things will be looked into. And Dr. Shanti, can you tell about any, what are the menopausal rating scale, or what are the history you'll be asking about her health?
Yeah, this menopausal rating scale was initially initiated in Germany. Then after that, it was translated into English and taken up by all countries later. And we have 11 components actually. So we have to, and we rate it according to the severity. So 0 will be, it is not present. And we have a maximum severe when it is 3 or 4. And actually all these come into 3 domains. One is that psychological, the second one is somato-vegetative, and the third one is erogenital. So simply we ask her symptoms like hot flushes, then whether she has any palpitation, then any sleep problems, This patient has sleep problems. She is irritable. So that also is, we have to take into account. Anxiety, then she feels tired. So that also should be taken into account. Sexual problems should be asked for. Bladder problems should be asked for. And any joint problems should be asked for. So with all these things, we can come to a idea about the effect it is having. This patient is a symptomatic patient. So she needs treatment, and when she has really come to us, she needs treatment and she has to be treated. So we have to initially ask for family history of other things like diabetes, hypertension, as you said earlier, and her history also, whether she is already a diabetic, whether she is already a hypothyroid, all these things should be taken into account. And accordingly, this patient needs treatment. That I'm very clear.
On further asking about various menopausal symptoms, she admitted that she's having history of hot flushes and stress urinary incontinence on further questioning, apart from her physical symptoms. So does she need any treatment for hot flushes? Dr. Padma, what do you think? What is the role of MHT? How do you give? Do you give? Padma is not there? Dr. Gita?
Yeah.
Madam,
Yeah.
okay, Geeta, continue.
Is there?
Yes, madam.
Yeah.
Yeah. Madam, this patient is she definitely needs treatment. She has, she gives you a history of hot flushes, and also she has irregular cycles. So for both the reasons, we can give her hormone therapy.
Okay. Should you not do you for because she is having frequent cycles? Do you want to do any other investigation?
Yes.
What is the basic investigation you like
We
to
do basic investigations with an ultrasound scan we do, and then accordingly we treat her.
So
probably I will do an FSH also, a basal FSH, just to have a knowledge. Now it's not needed actually, but then that really helps us so many times.
I would like to know whether the history of hot flushes has any connection with the late events in menopause. What do they?
Especially cardiac. So that is later after menopause, madam. Yeah, cardiac diseases, all
coronary
vascular. Probably it is an indicator for future cardiac events. So we that we have to know. So it's very important to treat her for that too.
So they say when you have a vasomotor symptoms at the age of 39, and though she has all this insomnia, irritability, she's a biology teacher, she's worried about getting menopause. She says, I'm putting on little weight and all this. So a detailed history, empathetically, you have to listen to her, because persistent vasomotor symptom is one of a biomarker for cardiovascular disease later age group. And they say they have found that coronary heart disease, stroke, and cardiovascular disease risk is around 1.4, 1.5 in cases who have vasomotor symptoms. So the patient, all the panelists agreed that she needs menopausal hormone therapy. So how do you start her on hormonal therapy? Do you think that any basic investigation apart from basic, you have to do it before starting MHT, or you straight away take her to basic investigation you like to do? Shanti, you like to do any investigation before putting her on MHT?
No, I would like to know, since we are basically prone for diabetes and lipid disorders, I would like to know her baseline value of her sugar. I would take her lipids, I would see. Then BP I would take, and probably she's 39. If there is no family history of breast cancer, clinical breast examination I would do, and then I would probably start her on.
So many times it's mandatory to do all these things, or it's optional.
No, it is not mandatory at all. But then this is the time we take it as a window of opportunity to evaluate the patient. Patient might not come back again. So this will be the right time for us to do all these things and counsel her appropriately. So I think I would view it that way.
So you have to do the Indian Menopausal Society guidelines says you do a proper history taking, physical examination, and a basic liver function test, fasting blood sugar, and you can do mammography is done actually in a case as with the 3 types. Either you can have a self-examination of the breast, clinical breast examination every 3 years, and menopausal screening is advised after the age of 40 years. But if you are going to start her on MHT, it may be optional in cases if it is available, we can do a mammography. So what type of MHT you want to start for this lady? She's having frequent cycles. She's 39 years. And what type of a thing how will you follow her? How do you investigate her? Batma?
I would prefer a cyclical therapy with the estrogen and progesterone. It is like a combined oral contraceptive pills is better for this patient.
Dr. Shanti, would you like to combine oral contraceptive pills, or you have any other drug of choice?
No, I would put her on lesser doses. That would be much better. That is what I feel. But sometimes there might be breakthrough bleeding also. So we have to counsel that too. But that will settle down. So I really think this patient, I would probably put her on menopausal hormone therapy. So I would, earlier also I told that I would be doing a FSH to know the basal value. So I think that will be much better.
Actually, we say in a transition age group, when a patient is having infrequent cycles, we can put her on low dose oral contraceptive pills. But for a vasomotor symptom relief, actually it's better to put a menopausal hormone therapy, which comprises of ethinyl estradiol with either a micronized progesterone, or we have a
dihydrogesterone also. Now we have neutral progesterone.
That is preferable to her.
Yeah.
But in the menopausal transition period, what we have is a low dose oral contraceptive pills with no other contraindication. If the patient is declining, she's a biology teacher, the mere fact that she says hormone, she's little apprehensive. What advice you will tell her if she doesn't want a hormone treatment, or is there any contraindication for hormone therapy?
So lifestyle modifications are better. First approach will be lifestyle modifications, madam. First, after lifestyle modification for 2 or 3 months, then we can start her on hormone therapy. So if she is feeling better with the lifestyle modifications like exercise, routine regular exercise, yoga, meditation, and like avoiding certain triggers like caffeine and spicy food and excess traveling and avoiding excess stress, she will be peaceful, and her sleep pattern may regulate, and her restlessness may settle down. If it doesn't settle down, then we can go for hormonal therapy.
I agree, the lifestyle modification is the first line, but many a times if the patient is having a severe vasomotor symptoms, simultaneously or after counseling, we may have to put her on hormone therapy. And the main contraindications, what are the main contraindications? The same lady is having any history of family
breast cancer. Like already she's a heart patient, or she has had some liver disease earlier, or she has had thromboembolism. Probably. But then anyway, lifestyle modification is a part and parcel of all these management of perimenopause and menopause.
Okay, so we will be putting the patient on lifestyle modification, lowering she has to lower the room temperature, avoid the stressors which causes the menopausal heart flushes, and we have to put her on. After proper counseling and investigation, we'll put her on hormone therapy. So now we'll go to the next case. And how do you follow her? How often we'll see her when your patient is on hormone therapy?
First, after the first month, I will ask her to come to check for her side effects, and I will check her weight and BP and after the first month. Then after that, 3 months later, I will ask her to come to assess the effects of the menopausal hormone therapy and compliance, if she's taking it, if she can take it regularly or not. After that, every year, I will ask her to come annually for a routine physical checkup and a scan.
Okay, well done. So once it's a vasomotor symptom, a symptomatic patient, especially in the age group of the perimenopausal transition period, definitely needs menopausal hormone therapy. And if you are catching them at that period, definitely has protective effect on the later onset diseases also. It protects against osteoporosis, it protects against when you have the vasomotor, MHT, it is found to have decreased the symptoms of all these sleep problems, mood swings, feeling down, and it protects against osteoporosis and decreases the all-cause mortality. So now with that, we'll go to the second case. Actually, this patient is a young lady. I just to complete the thing, any other drugs the patient is not willing or contraindication for hormone therapy, what is the other drugs we can give for similar symptoms?
She can take antidepressants like low dose antidepressants like sertraline and paroxetine, and she also can take gabapentin, and for her sleep she can take low dose melatonin also. 3 milligrams melatonin can be given, citalopram can be given, and clonidine also can be given. All these things can be given.
Whenever I read all about these non-hormonal strategies for vasomotor symptoms, I'm really worried because I'm worried about all the side effects of this serotonin uptake inhibitors and all this clonidine and gabapentin. Actually, gabapentin goes a lot about. As we obstetricians and gynecologists, we are very happily, we have been associated with hormones for so long. I think menopausal hormone therapy is course all above it, and my counseling maybe, though it non-directional, we have to be tell her that under the age of 60 and within 10 years after menopause, starting the menopausal hormone therapy, the benefits exceed the risk, and it's a drug of choice.
Venlafaxine will probably help her if she's still very recalcitrant about not taking hormone.
Yes. Thank you.
45. In a milder cases, we can advise for keeping herself cold and avoiding exposure more to the sun, and having something, a cold drink or something, and layering, dressing can be layered so that whenever she feels warm, she can just remove a few of her clothing and she can feel comfortable. And frequent showers will also help. And the bedding, preferably cotton, and all those things could be additive. And even the acupressure points can be tried. It's not going to be harmful. So those things also can be tried.
Acupuncture, cognitive behavioral therapy, all this yoga.
Yeah, cognitive behavior therapy.
And what our psychologists spoke now, mindfulness about everything what they do. Starting from mindful behavior, mindful eating, mindful sleeping, everything probably.
Okay. So going to the next case, it's a 45 years old lady, para 3. Her BMI is 23. She's a known case of rheumatoid arthritis and taking drugs on and off. She comes with the complaint of aches and pains all over the body for the past 1 year. She says she had a crack fracture 1 year back, for which she was just putting up a POP and rest of her forearm. And since that, she's feeling tired, always aches and pains are there. There is a family history of diabetes and hypertension. Menstrual cycles are now little infrequent and prolonged. Heavy flow for 2 days for the past 1 year. She says after the fracture only all these problems are there, and prior menstrual cycles are regular. So how do you evaluate her? What are the main risk factors? She gives history of, she's a known case of rheumatoid arthritis, and she says she used to be put on steroids now and then, but not regularly taking, and she has fracture 1 year back.
So, the risk factors, she being a female, being an Asian, then a case of being rheumatoid arthritis, then fragility, previous history of fracture. So all those things are probably important. So we have to also ask her about cigarette smoking, alcohol, and she's also sort of, her BMI is okay, not too bad, and she would have been on steroids. So all these things are very important. We have to ask her about her thyroid. So probably we can evaluate her by the FRAX score. This is available in online, and earlier we never had it for Indians, but now FRAX score for India itself is available. So here we will talk about what is that, her age, 40 to 90 years. That is what is taken into account. She is 45. So then her BMI, her height, weight, then whether the history of fracture, then whether her fracture was spontaneous or traumatic, that is trivial fracture, then previous history of any hip fracture in mother. So that is also very important, hip in the mother. So all these things, whether she's hyperthyroid, so now she's on glucocorticoids. So all these things, even BMD, all these things will be taken into account, and the fracture risk assessment will be done with this FRAX2.
So, well done. Fracture scoring by WHO is mainly to know the probability of the fracture in the next 10 years. And this FRAX score may include BMD, either you can with the DEXA or without the DEXA when the scoring is then. Dr. Batma, can you tell what are the indications for DEXA and thing? Do we do for all women DEXA, or when do we do a DEXA for any patient bone mineral density study?
A DEXA is advised for all post-menopausal women more than 5 years of menopause, and for post-menopausal women less than 5 years of menopause with risk factors like rheumatoid arthritis, glucocorticoids, past history of osteoporotic fractures, etc. And third indication is the women in menopausal transition with secondary causes like with the hypothyroidism, patients who have treatment for asthma, etc. And then women with fragility for fractures, women with X-ray evidence of osteopenia and vertebral compression fractures, and before initiating treatment for osteoporosis. And to measure, it is also used to measure total body fat and lean tissue mass nowadays.
Okay. So this woman, this woman is a 45 years old lady. And she gives history of all these things. So what are the basic investigation you would like to do in this particular patient? Will you do, she is having infrequent cycles and she has heavy periods lasting for 2 days. That is all her history. So how will you, before putting her, what are the investigation you would like to do?
I will ask her for a complete blood picture, madam, and then like hemoglobin, TC, ESR, everything. Then GTT is preferable. Then I will ask her to do a serum calcium or vitamin D, and then the serum urea creatinine profile, then thyroid TSH, and then an X-ray view, lateral view of the thoracolumbar spine, and to see if there is any small crack fracture in the vertebrae. And then I will do the vitamin D and the calcium levels, and then I will assess with the DEXA if needed. If she has a fracture, if she gives fracture-like symptoms, then MRI.
So all up to the MRI, just you are thinking in view of a fragility fracture she's having, yes. But at the simultaneously she's having infrequent cycles and then heavy periods.
Yes.
We may like to have a pap we may do a people endometrial biopsy to rule out other. So because once if you are going to start any treatment, you should rule out endometrial pathology. So this patient is there any role of, what is the window of opportunity? Is there any role of primary prevention of osteoporosis by menopause hormone therapy?
In early post-menopause and in symptomatic women, menopause hormone therapy increases the lumbar spine bone mineral density by 7% and femoral neck bone mineral density by 5% over 3 years. Hormone therapy if given for 3 years, it increases the density.
What are the other advices we give for prevention of osteoporosis or management of osteoporosis in this women?
So we give her a balanced diet and serum calcium, then vitamin D, then exercise, mostly weight-bearing exercise are helpful in avoiding prevention of fractures. Then we advise her to limit caffeine and sodium, to limit sodium uptake, and we advise her to take more of proteins, like around 1 gram of protein per kilogram body weight after in the postmenopausal period.
So, as we all know, the lifestyle modification, exercise, balanced diet, sunshine, prevent obesity, avoid smoking, this should be given. And then what are the drugs we are going to give? Calcium, how much we give? We may have to give vitamin D, level should be at least 30 nanogram. So we may have to give substitute vitamin D. Calcium, a rate of up to 1200 to 1500 milligram per day should be given. Exercise, all we have to. So the role of menopausal hormone therapy, what is the various societies says? It can be given for prevention and treatment in early postmenopause and in symptomatic women unless there is a contraindication. That is the Indian Menopause Society says. International Menopause Society says it's the most appropriate therapy for fracture prevention in early menopause. So the pharmacological therapy should be based on the various factors, the risk factors, and our FRAC score, what is our BMD. With that, we may have to have the pharmacological intervention. So what are the various pharmacological treatment available, and what are we going to give for this particular woman? She's 45 years, para 3, life 3, and she has had a higher risk of fracture and rheumatoid arthritis. And what are we going to give her? And how do we decide the various modality of treatment? Shanti.
So this patient, I think I will do a BMD, and depending on that, anyway, she has a previous risk factor also. So after evaluating her, I can, after advising increase calcium and all these supplementary things and active lifestyle, I can probably put her on menopausal hormone therapy.
So
other things, yeah, that is the best thing actually for prevention of osteoporosis, especially who have risk factors.
Especially the American Association of Clinical Endocrinology says it's effective for prevention of postmenopausal osteoporosis because the peak bone mass and the loss occurs mainly just 1 to 2 years before menopause and 2 to 5 years menopause. And here is a lady with high risk factor. So women at high risk factors for osteoporosis, MHT is advisable, and it should be prevention without any other contraindication. If she has any contraindications like for MHT, we may have to think of other drugs. And also if there are no risk factors, if the patient is not a suitable candidate for other pharmacological agents, MHT is the treatment of choice. By that means we can have bisphosphonate, various drugs are there. And if she has contraindication for therapy, MHT is one of the important therapy for prevention of osteoporosis. So symptomatic women, we can start her on MHT for prevention of osteoporosis. Without any risk factor, if she's not going to have contraindication for other drugs, you can start her on MHT. But so various other drugs which we can give apart from MHT or bisphosphonates, parathyroid hormone, calcitonin, especially in case of severe osteoporosis. So other drugs, like when we say MHT, what are the drugs we tell about MHT in this particular occasion for prevention of osteoporosis? Shanti.
Madam, I will, that is the components of MHT, madam.
Yeah.
I would start her on estrogen and progesterone in small doses, and I would prefer a neutral progesterone in the form of micronized progesterone or dihydrogesterone along with estrogen, but that is estradiol is much better. But then if she is unfavored, if she is not actually, if MHT cannot be given, then probably I will take recourse to other drugs.
Actually, with a woman who she's still menstruating, this cyclical hormone therapy will be definitely useful. If she's a postmenopausal woman and not menstruated for 1 year, more than 1 year, tibolone can be given. Especially, it can be another alternative for prevention of osteoporosis. And one of the other things is raloxifene. Raloxifene is the selective estrogen receptor, which has been found to be useful in prevention of osteoporosis. So with all this,
but with vasomotor flushes, probably it cannot be given.
One of the contraindication for raloxifene is actually vasomotor symptoms will be worsened in a case of raloxifene. That's what.
Put in patients with family history of breast cancer, all those things.
So if a woman with a family history of breast cancer, the treatment of choice will be raloxifene. If the patient is having vasomotor symptoms, either you can have combined that estrogen progesterone, or we can give tibolone. Other drugs are bisphosphonates. And what is the commonly prescribed drug for osteoporosis nowadays, Shanti? I don't know. If
now zoledronic acid, many people take recourse to it because it is only annually it can be given. And all endocrinologists use denosumab, teriparatide, all these things. But then necrosis of jaw, all that can be sometimes, can result sometimes. So I think gynecologists usually stick on to MHT, then alendronate probably, then tibolone, raloxifene, and zoledronic acid.
Okay. Whenever we use bisphosphonates, actually they say there should be a drug-free interval after a period of 3 to 5 years. If you are using a zoledronic acid, we should, after 3 years, drug-free period should be there in a case of IV zoledronic acid, and 5 years after oral alendronate. So these are the various, because as Dr. Shanti was telling, there will be necrosis of the jaw, aseptic, and there has been even atypical femur shaft fractures have been all reported in cases of long-term therapy of bisphosphonates. So one should be weigh the pros and cons if you are going to start her on bisphosphonates. Many a time the patient should be able to take it in an erect posture without oral alendronates. It can cause esophagitis and ulcers can be had. So if the patient is a known case of peptic ulcer, we cannot put her on bisphosphonate. So all the pros and cons should be found, and then we have to effectively treat her apart from lifestyle modification, calcium, vitamin D, sunshine, physical exercise, and other matters. So this is a overall. So as per the guideline, whenever we have more than 5 years of postmenopause, the BMD is low, normal, we can leave her. If it is osteopenia, no risk factors, we have to give lifestyle changes, and menopausal symptoms are there, we can have MHT and tibolone and bisphosphonate. If there are no menopausal symptoms, you can straight away go for bisphosphonate, raloxifene, and HT within 10 years. So all this menopausal hormone therapy should be started only less than 10 years of menopause and within less than 60 years of age. So this woman being 45 years, she had MHT and she was very happy and she was all right. Going to the next case, Mrs. X, 49 years with these just scanty infrequent cycles for 3 years at last menstrual period.
Sorry for the interruption. Madam, time is running up. Can you conclude in 1 or 2 minutes, madam?
Okay, ma. Okay, this is a case of a main complaint of insomnia. I have one more case. I need another 5 minutes, Dr. Sambat Mari. Main complaint of insomnia, a 49-year-old lady with a lot of stress at work. She gives you stuff, crying spells, children not at home, feeling guilty. What do you call this? How do you manage these women? We have had good lectures on this. Dr. Gita?
Yes, ma'am. We need to do the basic investigations for this patient. And then the case of midlife crisis, we need to sit and talk to her first. Like, what are her problems in a very confidential way, and bring her out personal issues and family problems and all those things. And like sometimes the children may be out, so emptiness syndrome. She'll be taking care of the elderly parents. All those things has to be taken up. And insomnia, like what are her sleep patterns? We need to advise her on her sleep system, like have a regular timing, keep the clock away so that the ticking is there, and dim the light in the room, make her comfortable. And the exercise, particularly exercise, like not close to the sleeping time. It should be well before it. All these things will help in getting a good sleep. And if she is very anxious and depressed, and little bit low dose antidepressants may be used in her, and her nutrition and exercise, all these things also need to be
Thank you, Dr.
looked into.
So medically, as you told, you have to tell about all the counseling, lifestyle modification, sleep hygiene, and insomnia should be treated by lifestyle modification. If needed, pharmacological therapy should be. I just rushed through the last case, a 39 years lady who is a BMI is 32. She's a paravan. She had 3 abortions. Last childbirth is 10 years. She's a known case of hypothyroidism, and she has 6 months amenorrhea. Her urine pregnancy test is negative. She feels her tummy is big. She's worried. She doesn't want to have a child, but she wants to know if she's pregnant. She's worried why she's not getting a period. How will you proceed? Does she need contraception? What are the investigation to clinch the diagnosis. 6 months amenorrhea, obese lady with a hypothyroidism. Shanti, what do you think?
Okay, this patient probably is going in for premature menopause, so maybe ovarian insufficiency. So that's we have to treat her. She needs treatment. She can be evaluated, and her basic investigations will all be done, like sugar, BP. Then a FSH will probably clinch the diagnosis.
Found to be 30 and GTT was impaired, and she said her family history. Mother had menopause at the age of 40 years, and so we think it's
premature ovarian insufficiency. It runs in families. We have to see whether she has other things like thyroid dysfunction or adrenal. So antibodies against thyroid. Adrenal antibodies very difficult to get. To do. So probably TPO antibodies can be done. And if she is usually this runs in families, but otherwise sometimes Turner mosaic or FMR mutation. So all that we have to, all these chromosomal anomalies also will lead on to
ovarian insufficiency, and we have now we are worried. She's worried whether she will conceive. She's 6 months amenorrhea. She doesn't want to become pregnancy. Do you think she needs a contraception? Is there any chance of conception?
Yeah, she needs definitely contraception, because like splash in the pan, they can conceive. So if she doesn't want a child, it's important to have contraception. Not only that, she has future cardiovascular risk, then future osteoporosis can be there. So because of all these things, she needs to be treated, and this can have an effect on her. She can develop genitourinary syndrome, and this can have an effect on her sexual life and her family life. So it's very important to treat her. And obese, so metabolic syndrome, we will look for like BP, then we will see for HDL, we'll see for fasting blood sugar. So all these things are very, very important.
I would like to know, tell me whether, how do you think that the metabolic syndrome can be just, what are the criteria to say she will go for metabolic syndrome, and how do we counsel her, how do you just treat her?
Gita?
Yeah. Metabolic syndrome is like the abdominal girth, and the LDL is more than 150, and the BP more than 130 by 80, and the fasting blood sugar more than 110. All these things. Weight circumference is very crucial. It's like 88 centimeters, and these have to be seen.
So this premature ovarian insufficiency, women can go for metabolic syndrome.
Metabolic syndrome
deficiency causes increase in the visceral abdominal fat, and that by actually she can be more prone for. So the number of years of reproductive age group, that is more important. When she has menopause less than 40 years, the reproductive lifespan less than 30 years, they have a higher risk of diabetes. So premature ovarian insufficiency have increased risk of diabetes, pre-diabetes, and metabolic syndrome. So how do we treat her, Dr. Gita? Tell me.
For her metabolic syndrome, like we can advise her on weight reduction, exercising, and if the glucose levels are a bit high, then we may start on low doses of metformin also can be tried. And this for her blood dyslipidemia, we can start on rosuvastatin if indicated. If she has got high blood pressure, in the case of metabolic syndrome, if she has had high blood pressure, we can start on low dose of any ARBs like that to control her blood pressures.
The main thing is we have to start her on estrogen is deficient. So we have to replace estrogen, and like menopausal transition, unlike that, we have to use a higher dose of estrogen slightly, so that she maintains good levels of estrogen. That itself will prevent she being history of GDM and obese and family history of diabetes. But starting this itself will prevent diabetes in her if she has not already developed.
incidence of risk of GDM. It decreases pre-diabetes, diabetes, and insulin resistance. So MHT is definitely useful. It decreases the abdominal fat deposition. It increases the lipid oxidation and enhancement of energy expenditure. So definitely MHT helps in the reducing the risk of diabetes mellitus. And the various studies have found, health study, WHO, all the study have found decrease in the incidence of diabetes by 35 to 35%, 25%. So definitely MHT should be started. We have to weigh the pros and cons, whether they are cardioprotective or risk of cardio. So risk versus benefits, and we have to start the patient on MHT. This woman had a cyclical MHT, and the way we all know, before concluding, we all the various society guidelines are that it is indicated for hormones are indicated for. You can just two lines each. All the three panelists will say the indication for MHT in guidelines. You just tell me we are before closing.
Yeah.
Shanti.
Yeah, for vasomotor symptoms, it is the drug of choice, and for genitourinary syndrome also, it is the drug of choice.
Dr. Padma, you would add anything regarding the menopausal midlife issues?
For osteoporosis, MHT is the best method to prevent.
Or with the risk factors, when other pharmacological drugs are contraindicated, we will be giving. And lifestyle modification and calcium iron, all we have told. Cardiovascular, it is not given for cardiovascular protection, but if it is started earlier for vasomotor, definitely the decrease in incidence of cardiovascular disease. So there are some, before finishing the midlife issues, MHT has its own side effects. We know that it increases the risk of venous thromboembolism, and it is not to be given for protection of primary or secondary prevention of cardiovascular disease. But what about the breast cancer? Can it just one add? Can we, does estrogen increases the risk of?
Actually, it increases, but then what the progesterone component is what is, which increases. And British Menopause Society actually has brought out a nice monogram where they say obesity increases breast cancer by 18 times. Then other things like previous history of what is that, smoking increases so many other times. So because of all these things, since these patients are being monitored, if menopausal hormonal therapy is indicated, probably it can be given. So that is what is the final type.
Other thing is the raloxifene, which decreases the risk of
breast
cancer. And tibolone is effective whenever you have a dense mammographic density in the X-ray, and it also improves the urogenital. So to
sorry to interrupt, madam. Madam, it's already time up, madam. Can you
40 years, menopausal hormone therapy is mandatory. 40 to 50 years, benefit exceed risk. 50 to 60 years, benefit exceed risk. More than 60 years, it should be evaluated. Thank you for the nice panel, all my panelists, for bringing up all the important points in treatment of midlife issues. Thank you, Doctor.
Thank you.
Thank you, Premlata, madam. It was an excellent panel. Thanks, panelists, Dr. Batma and Dr. Gita. Shanti, madam, thanks for joining. Please be there for the next session. Next sessions, may I invite the chairperson, Dr. Dhanlakshmi.
Panelist, Dr. Shanti Gunasingh, who has joined us a short period, Dr. Batma and Gita for wonderful interaction. Thank you, Doctor.
Thank you, madam.
Thank you, madam. We really enjoyed it.
As I told
Thank
this,
you, ma'am.
So, may I invite Dr. Dhanlakshmi, madam, and Dr. Shanti Gunasingh, madam, for the next session. Siri, please. Swati madam has been already introduced. Okay, she is a great mentor for many students. We'll move on to Dhanlakshmi madam. She is a professor in the Ramachandra Medical College. She's very popular among the undergraduate and postgraduate teachers. Over to the chairperson. Chairpersons will introduce the speakers.
Okay. Dana? Yeah.
Yeah. I'm happy to thanks, Epsi madam, for giving me this opportunity to part of this CME program today. And I was very actually impressed by the CV given by Mr. Gopinath Gunashekaran. And even though he's an engineer, he's taken to banking profession, and he's doing very well there. And I am just waiting for his talk on how to manage financial stability at midlife, and welcome Mr. Gopinath to this gathering.
Thank you, ma'am. Thank you. Thank you for that. I'm going to share my screen now. I hope everyone can see my screen now.
It can be seen. Please continue.
Okay. We will be seeing about financial planning. Why I am thinking about and speaking about financial planning is a process where we are planning our finances to meet our life goals. Life goals can be anything. It varies from individual to individual. One may think that buying a house is its goal, and another may think that higher education of his children. Another may think that retirement in some highland in US or America might be his goal. So based on his goals, we need to plan at that earlier stage. And why this gains importance in India nowadays is we are becoming nuclear family, and moreover, so our goals need to be supported from our own finances alone. So earlier we were supported by our extended family, but now this nuclear family setup, it becomes imperative to do financial planning. So what is financial planning? Many think that financial planning is just saving their money in an FD, or else buying gold, or else buying some fancy insurance products. But I don't think so. Financial planning it's like a process which should be followed right from the day of starting earning and the day where we go for retirement. So it might be for 30 years or 40 years. All those 40 years, we need to have a financial plan to reach our goal. So this financial planning starts with wealth protection, wealth creation, and wealth distribution. We Indians always think about wealth creation. Wealth creation is an accumulation phase, but before going for wealth creation, we need to go for wealth protection. Wealth protection is seldom thought by us, and it forms the important part of financial planning. And wealth protection starts with insurance planning and emergency fund analysis. What is this emergency fund analysis is? During our life, we are earning some income which might be differing from person to person, but we need to have an emergency fund which will support us during our hardship. Some might be ill, we might be facing some health issue, and we might be put out of our work for 6 months or 1 year. So what a financial planner should ideally advise a person is they should hold 6 months to 12 months of their monthly expenses as cash or near cash investment. Near cash investment in this situation is FD. So ideally what one individual should do is they should hold FD of their 12-month expenses. So once our monthly expense, if our monthly expense is 1 lakh, we should ideally hold an FD of 12 lakhs, which should be highly liquidatable. So liquidatable in the sense means one can liquidate the FD on the very next day if he wants that money. So this emergency fund comes first as the first step of financial planning. Then comes the protection planning. This protection planning is the life insurance. And we need to first understand that insurance is not an investment product, and insurance is just an risk mitigation product. So how to go for insurance? Insurance, we should ideally go for insurance based on our income. So today I'm working, I'm making income of 1 lakh per month. So ideally I'm making 12 lakhs per year. And based on this 12 lakh, my family's expenses and my investment or my goals would have been based. So if something happens to me, my family will suffer. So for that, I should have a life insurance which will compensate. This is just like a compensation, not for any investment. So in this case, how to go for life insurance? So ideally, if an individual is earning 15 lakhs per year, you should go for 15 times of his annual income. So this 15 times of annual income is around 2.25 crores. So this 2.25 crores should be your ideal insurance. So this, if I am saying 2.25 crores, you should minimum have 2.25 crores because as your income is 15 lakhs per year. So as our income increases, our lifestyle will also increases and we used to spend more. So we should not say that I will have insurance for 50 lakhs, I will have insurance for 1 crore. This amount should be based on our income and based on our expenses. It is always better to base it on our income. Life is more uncertain and we would have understood it more during this COVID time. So we cannot say that I will live for 60, so I don't need an insurance. So insurance is a product which has no alternative. So this insurance, life insurance, you should ideally have a life insurance value of 15 times of your annual income. So this you can calculate on your own. And next, you might have multiple products for insurance, but ideally I will advise you to go for term insurance. Term insurance is a product where you will be paid your sum assured only on death. So there will not be any money paid to you once the insurance gets matured. For in my case, I'm working in a bank, so I will retire at the age of 60. So I have an insurance which will give me 1.5 crores only if something happens to me. Something bad happens to me. If I retire happily at the age of 60, I won't be earning anything. But for this term insurance of 1.5 crore, I pay premium of just 10,000 per month, per year. So ideally, I would have paid 3 lakhs over my entire earning period. But if something bad happens to me, I will be getting this 1.5 crore, which will support my family during their time, because it will be supporting them during their financial hardship. They can, because we cannot support them emotionally, at least financially, they should have some support. So this is the first step everyone has to do. Then this non-protection, non-life insurance also we need to think. So that most important thing is medical insurance. Medical insurance, everyone should have medical insurance, because medical insurance is, medical inflation in our country is about 15%. So medical expenses increases 15% every year. So we should have a clear medical insurance. So that I'm not saying about any particular company or product. You should ideally have a medical insurance of at least 50 lakhs, which will cover almost all major surgeries in some major metros. So if you are not in metros, 50 lakhs should be on higher side. But if you are in metro, we need ideally 50 lakhs of health insurance. So this step forms the first step of financial planning, where we are just protecting our wealth. So once this step is completed, this would have cost us around 30,000 per year. So once this step gets completed, we need to think about our wealth creation. So we need to accumulate wealth. There are multiple ways that you can accumulate wealth. But what we naturally do in our country is we go and buy gold, we buy real estate, or we keep on investing in FDs, fixed deposit. The problem with fixed deposit in our country is inflation. Inflation is the most problem thing in our country, because in developing economy, inflation will eat up all your savings. We always think about Western economy and compare their method of investing and try to copy that method of investing. But problem with Western economy and Indian economy is, Western economy inflation is hardly 1 or 2%. They want inflation. But Indian economy, the problem is we are facing very higher inflation. Even this year, our inflation was always above 11.5%. So you need to understand that if inflation is above 11.5%, for example, a sum of 100 which we have earned last year would be worth only 88 rupees this year. So for example, you would have saved this 100 in an FD. This FD would have given you 7%. So ideally, you would have got 107 rupees. This 100 would have been 107 rupees at the end of 1 year. But this, after adjusting this inflation, your real return would be 95 rupees only. So whatever investment you are making is no good. At least you would have spent that money current year. That would have made you happy. But we are going for investing FD investment, thinking that we are making some money. So then what is the solution for this? How to beat an inflation? Only legal way to beat inflation is through share markets only. Share markets in the sense equities. So you can ask this question, how I can go and invest in equity? I don't have time. I don't understand this equity market. Then how I can invest in equity? Is there any other way or traditional ways where I can invest and make money? But I have to reiterate once again that there is no other way to beat inflation. There is another way, which is real estate. But real estate comes with its own problem. Real estate is the most illiquid asset. If you are having some problem, if you are going to sell a property, it will be the most illiquid asset. You might take 6 months to 1 year to sell that property. Even if that property, if the buyer understands that you are at distress, they will buy the property only at distress price, not at the market price. Real estate is the most illiquid. But you should have investment in real estate also. But more prominently, you should invest only in equity markets. So all your goals should be rooted through equity markets only. So you could have seen lot of advertisement nowadays in television and all sort of print media that you need to invest in mutual fund. Because last 3-4 years, awareness for investing in mutual fund has increased a lot. And I would advise everyone to go for mutual fund irrespective of the brand. So I'm not trying to promote a brand. I'm trying to promote an investment avenue. Please don't think that I can make an investment which will beat inflation on consistent basis, which is legal. Why I'm repeatedly saying legal is some might say that I can lend the money to someone who will give me 12%, 24%. There are some investment companies which will give you 24%, but this will not sustain on a long run basis. Only real equity investment can give you real returns. But for that, we need to understand that how to invest in an equity investment. So equity can be invested in two ways, where we can invest in directly in share market by opening an account with some brokerages, or else you can go for mutual funds. Mutual fund is the basic way of investing in equity. So I would advise everyone to start looking at it. At least have you might be busy. I understand most of the doctors are busy. They are more interested in looking at patients and rather than interested in investing, because a lot of my customers who are doctors, they won't invest. They just put their money in FDs or in moreover, they will keep their money in savings account also. They don't have time to invest, or they are not inclined to do these investments. But you have to make some time to understand what is mutual fund. I would advise you to do so. In mutual fund, there are investment avenues where you will be investing in both debt instruments and companies. So if you are really having time, if you are really have time to spend at least 1 hour per week or else 1 hour per month also, that is moreover sufficient to start your investment. In mutual fund, you can easily get 12% of modest return without spending too much time on that. Why I am telling this 12% modest return is, you might have heard this word Nifty and Sensex. This word Nifty and Sensex is repeatedly fed to customers through all news channels. This Nifty is representing our Indian economy. So this Nifty is a group of 50 shares which is representing Indian economy, where you don't have to think about all those shares. This is managed by NSE, National Stock Exchange. If you would have invested in Nifty for this 30 years, you would have easily made 12% of return on consistent basis. So you need to think about mutual fund. There is something called compounding, power of compounding. What is power of compounding is money invested for a longer period and giving a investment of compounded annual growth rate of at least 12% would have given you humongous return. For example, I am telling you an investment. You are investing 50,000 per month for 30 years. So, and this 50,000 is invested in this Nifty without any, you take in the case that investor has gone to coma. After 30 years, he is getting up and he has made regular investment of 50,000. At the end of 30th year, you would have invested 1 crore 80 lakhs, but his return would be 15 crores 84 lakhs. This type of return, I am telling it as a modest way where no one has invested, no one has spent his mind or knowledge on how to invest. He is just investing in Indian economy based on this Nifty and Nifty, where it has given 12% on consistent basis, where this 12%, this 50,000 will be 15 crores and 84 lakhs. I am not exaggerating. This is the power of compounding. So in this case, you can understand and you can think what will be the money if you are capable of investing 10 crores. If you are investing 10 lakhs per year, your return would be 30 crores. So this is not an exaggeration. But whatever I have said and done, people might say that I don't have time to do all these things. For this, what I would advise is you need to contact a financial planner. Financial planner is different from a tax planner. So people think that financial planner means he is a chartered accountant, auditor. Chartered accountant is just for looking at your profit and loss and balance sheet. He is not a financial planner. He is not an expert person to think about your finances. So you need to think about a financial planner who will be investing your money in different products. He will be diversifying all your money and he will ensure that you are making good returns. So you need to you need to go and meet a financial planner. He will help you in doing all those things. So I am a financial planner, but I am associated with a brand. So I am not telling you to come to me. I am just telling you to reach some financial planner who will guide you. Then final part comes, you have made money. Finally, you have to move this wealth to your next generation. There comes these three important things of nomination, will and trust. So if you have a savings account, FD or any financial instrument, please think about nomination. Please make it sure that you have filled your nomination in all the accounts. Then comes the will. Will is the most powerful instrument. Whenever you have acquired any property or any sort of, whenever you have made any sort of investment, you need to create will. Will ensure that your assets are passed on to next generation without any sort of problem among the family members, because nowadays we are seeing lot of problem among the family members for dividing the wealth. So once the income earner passes away, family members have feud among themselves that this wealth comes to me, this one comes to them. So we need to create will. Will is not an exotic product. Anyone who is creating asset, they need to create will. Will can be created without any sort of expenses. Just you have to write your goals. Sorry, write your way that how you want to pass on the wealth in a white paper, and you can get 2 nominations and keep it in your wardrobe. This will act as a will. So will is the most easier product, but seldom used in India because people think that will is some exotic product. Only people who make in million have to make a will. People who are creating an asset, who have purchased a property, I have to create a will, because will ensure that your property is passed on to the next generation in a smoother way and proper way, where they won't be having any problem and they won't face any tax issues as well. Then last comes tax planning. Tax planning, people think that tax planning is investment. Tax planning is not investment. You cannot evade taxes. You cannot escape taxes. After a point of time, if you are earning more than 10 lakhs per year, I would like to say you don't have any other way but to pay taxes. So you have to think of ways to invest and earn money rather than trying to think of ways where we can reduce tax. You cannot reduce tax because these are the 3 sections where you can reduce taxes, but these limits are already fixed 15 years back. So for example, section 80C, you can reduce 1.5 lakhs by investing in a life insurance. 80D is Mediclaim, that is for 45,000 only. 24B is for home loan interest, that is for 2 lakhs only. So totally you can save up to 3,80,000. So, but nowadays our income has gone a lot. So we cannot think about tax planning, but I'm seeing doctors are more obsessed toward taxes. They are asking me how to reduce tax, how to reduce tax. You cannot reduce tax. Tax you have to anyway pay. What you have to ensure is that you have to make investment which will beat your taxes, which will give returns, which will beat all these taxes. So you need to think less on tax planning, more on investments. And invest. Then why you need financial planner is he will be assisting you in all through your life, and he will be charging a modest fee of 1% of your total value is monitoring. So 1% is a moderate return, where if you have invested in FD, you will be gaining only 6%, where if you are invested in a properly advised mutual fund, you would have got 12%. There you could have paid easily 1% to an advisor, and you could have easily made 5% of risk-free, hassle-free, and without any tension, you could have made this 5% easier. So you please don't think that financial planning is for rich people. So you have to think about all these things. At the nutshell, I have to say, you have to think about financial planning and estate planning right on this day, because we have crossed, this session is about midlife financial planning. We have already crossed wealth protection stage. You should have ideally done that. If you have not done that, you should start financial protection, then wealth creation. Then you have to think about estate planning. If you have already started purchasing property or creating wealth, you have to think about estate planning as well. So think less about tax planning. That is the takeaway I would like you to take, because most people ask me how to reduce taxes. Taxes are the only, death and taxes are the certain thing in this world. So you cannot reduce tax. You have to pay tax. You have to think about investments which will give you returns which will beat all your taxes. So this is a misconception I have to say and close this session. Financial planning is for rich. No, financial planning is not for rich. Financial planning is for everyone who starts making money. The goal might be different. The poor man might have a goal that he wants to buy a house in some village. That is his goal. A rich man will have a goal that he wants to travel all over the world. So the goal might be different, but financial planning is for everyone. Insurance planning is not financial planning. Don't think that you have bought some insurance products with LIC and my financial planning is completed. Financial planning is not an insurance planning. Tax planning is not financial planning. I am young, but in this case, you are not, you are almost old. So you need to, you guys, everyone need to think about financial planning. And confuse financial planning with investing. People will feel that I am investing, so I am financially planned. No, you have to think about your estate planning as well, because you need to pass on your wealth to your next generation smoothly. This is more gaining more prominence now, because we are seeing lot of problems among siblings for dividing the wealth of their parents, because there is no proper planning, succession planning. So planning is more important. And I would like to close this session. Failing to plan is planning to fail. So please think about financial planning. We are already late. We need to start it. And I would be ready to advise you on, I can't advise you on products because I'm associated with the brand. I can advise you to approach some financial planner, because I'm in this industry. I know people. So you are from different cities. You can tell me, I will advise you, and you can meet them. They will be better placed than me to advise you, because they are in this financial planning industry for more years. They will be charging you moderate fee. Don't think that they will be charging you fee that is unnecessary. Everyone needs financial planning. You can be in peace if you do financial planning, and you can make retirement in a smoother way. Thank you, ma'am. Thank you.
Thank you, Mr. Gopinath. I know as doctors, we are very bad planners when it comes to finance. We are very good planners for our patients when it comes to their treatment, surgery, their post-op recovery, everything. When it comes to our personal financial planning, they're very bad. Thanks for opening our eyes at least now, and we should be thinking about it seriously. And maybe, as you had advised in your last 1 minute of your talk, that we'll be approaching the appropriate persons and never minding that marginal fee that you have to give them. We should be able to invest our hard-earned earnings a better way, so that we have a stress-free financial life hereafter. So not only healthy life, even a financial life has to be healthy. Thank you, Mr.
Thank you.
Gopinath.
Thank you.
So let us go on to the next talk. We all know that lifestyle modification seems to be the mantra for any condition now. And we have a lifestyle medicine physician who is also a renowned physician, robotic surgeon, and urogynecologist too, who is going to talk to us about lifestyle modification at midlife. Probably she's the most appropriate person with her newly acquired certification. She's academically, she has been very strong, and being a Johnston medalist is not an easy thing. So we really appreciate that. And she has been on a medal spree also during her undergraduate days, and has worked in UK, and since 2012 she has been associated with Apollo Hospital, and she is also an MRCOG trainer and examiner, and also the same for DIP&B, and she has been the organizing chairperson for Febicon, and she's an active member of various organizations like ICS, Ayuga, UPIA, IAG, and she has been a prolific publisher of articles too. Dr. Meera Raghavan, please, the stage is yours now.
Thank you, ma'am. It's a great honor and pleasure to be among so many veterans, and that was a lovely talk by Mr. Nath and everybody else. Am I allowed to share screen now? So, very appropriately chosen topic is about why we need lifestyle modifications in midlife. So, like men are faced with andropause, women are faced with menopause, which completely disrupts the homeostasis and the advantage a woman has over men. Estrogen in particular is a very protective hormone, which basically balances the lipid profile pretty much very well. So we are at an extra advantage of having lesser cardiac event risk during the reproductive age group, which is why the most dreaded factor that estrogen deficiency is going to alter any of the lipid mechanism is a disadvantage to women who undergo premature ovarian failure. And that is the reason we need to concentrate on the lifestyle modification, especially around midlife, because all of us inevitably will undergo menopause some point or other, the average age being 46 to 2. So what essentially is lifestyle modification? It is a 6-pillar pronged therapy, if I may say so, or a science which deals with very important determinants in everyone's life, which has to be addressed clearly and adapted, not for 2 months, not for 21 days, not for 90 days, for a Christmas or a wedding or an occasion. This is going to be the way of life forward. If we adapt it to be a way of life and change for the better, this would be the actual essence of lifestyle medicine. So I wouldn't call it a diet, I would call it appropriate nutritional prescription. The second aspect being activity with amounts to exercise. There are various types of exercises, And clearly, exercise in its own merit enhances the ability of a balanced nutrition to cause weight loss if that is what is required, to gain muscle if that is what is to be done, to increase the flexibility, to increase the strength, to increase the endurance of anyone to perform certain activities, and thereby gives a synergistic effect to increase the longevity. We clearly describe one has to live a life in a box. What that does mean, you have to have a long life but die short, which means chronic illnesses or our battle against the non-communicable diseases, which are pretty much metabolic disorders. People live long, but they die long as well with the chronic illnesses such as diabetes and its forthcoming complications with hypertension, cardiovascular, cerebrovascular disorders, and vasculodegenerative disorders such as stroke and Parkinson's. So when you mean you're living a life in a box, you live long and die short, which means you have had a good quality of life. That is what lifestyle medicine aims to achieve. Not only just prolonging your life, but also providing us with the correct quality of life, which is what anyone would dream about. So these next two pillars are basically sleep hygiene and proper management of stress. It is easy to tell people don't get stressed. It is the trigger for anybody to become stressed is probably universal and ubiquitous. But how we each of us react and respond to the stress trigger is what we can control. We cannot control the trigger. We cannot control the various factors in our life which causes those triggers, because all of us would have to go through it at one point in our lifetime. But how we react and respond to this trigger is what the essence of stress management is all about. And the next is positive psychology, which is the fifth pillar, where we engage with positive emotions in our brain and properly develop relationships in a constructive manner with these aspects, and then adapt the meaning of the whole thing in establishing certain changes in our lifestyle and celebrate those accomplishments which we have achieved. For example, take a person who has never probably exercised all life through, and at the age of 50, they're diagnosed to be diabetic, or they have met with a road traffic accident, and they are desperate to make some change in their lifestyle. Their life phenomenon does not allow the time or the space to make those life changes. What they have to then do, potentially with this health scare or a road traffic accident or a speed breaker in your life journey, generally is a major stress factor. Many people react in a way they become anxious. Some people become depressed. Some people have a nervous breakdown. Some people see it as a challenge and move on. So we need to find out what positive emotions. COVID pandemic, the lockdown is another classical example for many of us who are not being able to see each other physically, but had lots of time on our hand, if at all, and we were not able to do many things. But if we were to take in all the positive emotions associated, how better you could become exercising, how better you could become engaging with your family and having good quality family time, and then ensuring that you build bonds within your family or yourself for that matter, establish a meaning for the pandemic itself rather than getting depressed, and celebrate the accomplishment at the end of the pandemic is a very good way of applying the technique of positive psychology even during times of crisis such as the COVID era. The last one is avoidance of addictive substances. I specifically put a child with a gadget because this is now much more a bane rather than the alcohol, smoking, or recreational drugs itself. Getting children of gadgets, getting elders of gadgets, getting ourselves of gadgets itself is a task. And like food, the gadget addiction is rife and this is something we need to address all about. So why particularly middle age? Why particularly menopause? And menopause is inevitable. Menopause is physiological. It's a natural event. It's normal. And anything within 1 year of no confirmed bleeding and beyond that will be confirmed to be menopausal state. It actually marks the cessation of menses, basically because the ovaries stop functioning due to aging and the loss of the follicles. So naturally occurring age is about 51, but prematurely it is usually iatrogenic, either by surgical extirpation of the ovaries or by chemotherapy, or at any time because of the premature ovarian failure. We all know from various studies that these are the usual warning signs, or if not the classical pattern of menopause, where there is a early change in menstrual cycle pattern, vasomotor symptoms including night sweats and hot flushes, vaginal dryness, and dysfunctional sexual symptoms such as pain during sexual intercourse, and sometimes associated with menopause are sleep disturbances, more so associated with the vasomotor symptoms. Definitely women complain of cognitive concerns, decline in short-term memory, inability to focus, having poor concentration, a poor attention span. Alongside with that, psychological symptoms such as mood swings, tearfulness, anxiety, sometimes phobia, and depression as well. So how do we approach these women? Basically, women can have lighter bleeding, heavier bleeding, duration of bleeding, cycle length can be varied, and skipped menstrual cycles. When we have excessive bleeding, either in the volume or a longer duration of bleeding or a shorter interval between two bleedings, we call it abnormal uterine bleeding. The prima facie cause for this is inevitably overweight or obesity, because there is extra ovarian fat production of estrone and estriol, which can trigger off excess estrogen in the body and thereby an anovulatory imbalance, leading to increased thickening of the uterine endometrium, thereby triggering off an proliferative pattern and an abnormal uterine bleeding due to hyperplasia. Vasomotor symptoms, as many as 75% of the perimenopausal women, the Caucasian population can have, or in the US particularly, can have hot flushes, triggered by small increases in core body temperature, and treatment based on symptom severity also depends on your personal attributes as well as attitudes towards menopause and the associated medications you're taking. Vaginal symptoms can be vaginal dryness, significantly vaginal atrophy, which is progressive and not going to resolve very quickly, but maintaining regular sexual activity is very important. This is when positive emotions and positive psychology help a lot. Having good self-esteem, having a good opinion about self-image, being socially active, socially connected, and not becoming depressed of what the physical changes are. The beauty within is what is beauty outside, and beauty is in the eye of the beholder. So these kind of positive emotions and harnessing these positive emotions on a day-to-day basis will help improvement of the self-imagery and the self-esteem, and thereby probably help them to indulge in regular sexual activity, thereby reducing the vaginal symptoms of dryness and dyspareunia. And we all know sexual health is a complex phenomenon. It is not just physical, it is psychological, it is biochemical, and there is a neuropsychiatric element to the sexual health as well. So decreased estrogen causes a decline in vaginal moisturization and elasticity. Increased testosterone will cause a decrease in the libido. For an active sex life, lubricants and moisturizers and local estrogen therapy will help. It is also important to have good optimization of one's weight, avoidance of alcohol, maintaining good sleep hygiene, and being physically fit with regular exercises, especially pelvic floor exercises. If you have a prolapse, if you have an incontinence, if you have fecal incontinence, if you have a constipation, a rectusine, vaginal dryness, there is obviously physical factors which will be an impediment for regular sexual activity. These can be easily prevented and tackled by maintaining good exercise, maintaining optimal weight, having good sleep hygiene, and avoidance of alcohol, and a positive imagery. So all the pillars of lifestyle medicine go hand in hand, even for maintaining sexual health. Don't forget the sexually transmitted infection screening. They should not assume that postmenopausal women are immune to sexually transmitted infection. In fact, vaginal atrophy causes the lack of the estrogen barrier and thereby predisposition to the sexually transmitted infections. And sleep disturbances, again, very, very important. Frequent insomnia, early awakening, not able to go to bed or not able to go to sleep. And the other factors which influence the sleep pattern are nocturnal urination, especially if you're a hypertensive, especially if you're on cardiac medications. You can go to the loo much more frequently and have a shift of the urine output, which is normally 70% during the day, 30% during the night, and the tip over balance happens after middle age, where you can have 50% in the daytime, 50% in the nighttime, which is significantly disturbing. Sleep-related disorders typically happens in obese women and people with metabolic syndrome. We have a very good questionnaire called the Stop Bang questionnaire. So S for sleep, snoring, T for excessive tiredness during the day, O for obstruction during sleep, and P for pressure-related problems. If women tick all these boxes, they're possibly suffering from obstructive sleep apnea. Whenever you see a woman who's short-statured, has a very short neck, is obese, especially centrally obese, has marked hypertension, she's probably a candidate of moderate to severe sleep apnea. Those definitely respond to lifestyle changes, especially optimization of weight and good sleep hygiene and CPAP, of course. And ovarian hormone changes and stress and negative emotions. And as I said, not so good feeling about their own self, all influence the sleep patterns. Hot flushes could be disturbing and is definitely a contributing factor. And decisions on whether how to treat with behavior or drug therapy depends on the severity of the sleep disturbance and what is the context of the sleep problem, whether it is the physical issues or the life stress related issues or insomnia per se, which is causing the issue, and whether they have an impact on the daytime consequences. If they are OSA, you can spot them sleeping while they are watching a serial. They will not be as perky in the daytime. They'll be still groggy during the daytime. They could sleep anywhere. Even before you switch on the gear of the car, they would probably be asleep. That denotes probably they've not had good quality sleep in the night and could be a feature of obstructive sleep apnea. Cognitive changes. Midlife women should be counseled that memory and concentration problems are not just related to menopause, but as a part of normal aging. They always say it is hormonal. When you also reinforce the fact, it actually becomes a negative tool for the woman herself who's suffering, because the whole family will say it's hormonal. So the whole family will disregard the fact that she could be suffering from serious illness for an early onset Parkinson or a stroke, which is mini in nature, a TIA, or an early onset dementia. So never ignore these cognitive symptoms or disregard them as probably just due to menopause. It is probably due to vascular, it is probably due to the normal part of aging. That is when family history and a detailed medical history should be looked into. And lifestyle modification, again, go a long way in postponing these cognitive changes or reducing the impact of the cognitive decline on day-to-day activity. For example, brain games, making the brain more astute by playing Sudoku, even putting our columns. We had one of our sessions where our columns are a matter of extensive coordination between the left and the right hemispheres, or engaging in memory games, engaging in meaningful conversations, which could bring out their creativity as well as recall of events. These are the way we could ensure the lifestyle modifications preventing further decline in the cognitive function. Mood disorders, feeling of upset, loss of control, irritability. I think all of us will be able to relate to it. Fatigue and feeling blue or down in the dumps. And women with a history of premenstrual syndrome, significant stress, sexual dysfunction, never to forget domestic violence, sexual abuse in the past. These will all be haunting them and can precipitate a significant depressive disorder. So a very important point is that they have to be very detailed in the medical history and also deploy the positive psychology aspects of trying them to wean away from the negative emotions of the past and trying to deal with what they have accomplished in their life so far and trying to deal with the positive emotions which they have achieved from their accomplishments in day-to-day life. The most predictive factor for depression at midlife and beyond is prior history of clinical depression. So anybody with postpartum depression, anybody with a reactive depression which needed medications for normal events such as the loss of a parent or a spouse in the previous years would be a marker and a strong predictive factor for depression at midlife. Relaxation and stress reduction techniques, maybe some medications, counseling or cognitive behavior therapy are options to consider in symptom management. Urinary symptoms, again, a common aspect in midlife, possibly due to the weight gain which is associated, vaginal atrophy, or the changes due to estrogen deficiency. Over 50% of the women beyond the 50th year with urinary incontinence also report symptoms of overactive bladder. Weight loss is a key to the management. Can't emphasize this even more. Even 5% weight loss categorically improves incontinence in nearly 50% of our patients. Avoiding smoking or avoiding tobacco of any form again improves incontinence by 50%. Kegels exercises improves incontinence in nearly 50% of our women if done regularly under supervision, at least for a period of 3 months. So these are the ways where lifestyle medicine incorporation will improve incontinence even before we contemplate medical therapy or even further any invasive therapy. Coming to osteoporosis, again, a major threat, as correctly pointed out, silent epidemic. Cause for it, compromised bone strength and lower estrogen levels. Apart from that, many of our women are diabetic, which then further enhances the bone loss, causing them to become more and more osteoporotic. There are various risk factors, and we all know our facts tool and the osteoporosis risk chart. Being a female sex itself, family history of congenital fractures, tobacco use, long-term use of steroids, rheumatoid arthritis, everything will contribute to the enhancement of the risk of osteoporosis beyond the additional insult of menopause itself. So recommendations, apart from the management, will definitely concentrate on lifestyle change. Avoidance of sedentary lifestyle, avoidance of harmful substances such as tobacco, making sure they exercise with incorporating balanced exercises every day for 30 minutes, making sure they are on a calcium as well as magnesium rich diet are small lifestyle modifications which go a long way in reversing osteopenia and also preventing the progression of osteopenia to become osteoporosis. By this, we can definitely postpone the onset of fragility factors or maybe even reduce the risk of fragility factors, which can be quite incapacitating. Moving on to cardiovascular health, second leading cause of death, and probably in women, as far as India is concerned, may become the leading cause of death itself, and increasing at first time in 4 decades. This is truly a battle which we have to fight because the contributory factors are obesity, diabetes, and hypertension, and people becoming sedentary around midlife. So for better cardiovascular health, we have to look at our lipid profile, and clearly we have to act during the window of opportunity where women present for menopausal symptoms, we could be making a potentially positive impact on their chronic well-being by addressing these parameters when they come to us for a gynae consultation. Ensure the lipid profile is maintained, especially look at the HDL, which has to be maintained beyond 50, because a low HDL is a much more risk factor for cardiovascular event rather than the LDL itself. So the only factor which will improve the HDL is physical activity and exercise. Again, a lifestyle intervention. Ensure maintaining blood pressure less than 120/80. Make sure the fasting blood glucose is maintained less than 100. BMI, more than the BMI, aim at this waist circumference. I'm sure all of us from now on will be walking with an inch tape, measuring our women's waist rather than using the stethoscope, because that's a simple marker, easily done, and if maintained less than 85 centimeters, can reduce the risk of cardiovascular disorders and cerebrovascular events significantly more than the medication. Avoidance of smoking, ensuring good physical activity, and DASH diet. Again, cancer. Menopause is not necessarily associated with increased cancer risk, but we need to look at cancer in women significantly relating to breast cancer, colonic cancer, endometrial cancer, and ovarian cancer. We have to be making sure that they have their regular checkups, the master health checkup, mammogram every 2 years, pap smear if they have not done, and evaluating the endometrial thickness, or evaluating without ignoring even a single episode of postmenopausal bleeding, because endometrial cancer is on the rise, again due to the metabolic syndrome, which has become an epidemic. I've already mentioned about the pap smear. So how do we approach our women? I need to clarify the myths around 40. Fat-burning food is a farce, and that's a fact. There's nothing called fat-burning food. I've seen women who say, I drink 3 cups of green tea, or I take lemon and honey in warm water in the morning. It might be soothing for the throat, but that alone will not reduce the weight. You probably need to exercise, maintain a sensible diet, then it will be synergistic to the fat burning. That alone will not melt the fat away. No exercise after 40. It's not a fact. It's a farce. Slim people do not need to exercise. That again is a farce. There is a classical habitus of Indian women, which is called the toffee, thin on the outside, fat on the inside. They have a lot of visceral fat, which is far more dangerous to the metabolic parameters as opposed to somebody who is metabolically fit, obese people. So slim people need not exercise. Again, a farce. They could be slim, not because they are fit. They could be having significant muscle loss, which we call as sarcopenia, and not very fit at all. No gym after 40. Again, a farce. Gym ensures proper strength training and buildup of muscle, which could help you tackle your diabetes better and maintain your weight in a remarkable fashion. No weight training after 40. That again is a farce, and mix of exercise is not correct. Again, a farce. Unless you do a mixture of exercises with your cardio, your strength training, the flexibility and yoga, you will not be balancing your ability to endure exercise as well as be able to be flexible. So there are certain hormones involved in our eating, such as the leptin, ghrelin, and dopamine, insulin, and estrogen. Leptin, which is secreted from the brain, suppresses hunger. So increasing the leptin amounts by doing activities which not necessarily are related to food and enhances the leptin secretion, thereby suppressing hunger. A lack of insulin or the resistance to insulin can again be prevented by building up the muscle mass, because the muscle is the only tissue which utilizes insulin to the maximum. Lack of estrogen again sensitizes body to other hormones such as insulin, and thereby overeating can happen in women who are menopausal around midlife. So how do we plan a sensible eating? I'm sure the previous lectures have already addressed it. Go for a whole food plant-based diet. Turn your plate around. Make sure you have less of carbs. Amongst the carbs, choose the one which are whole grain and not the one which are refined and white. Learn the food groups. Extreme dieting is never going to be a sustainable option. The option which you're able to sustain for more than a month, which you're able to sustain even when you're traveling. the option which you're able to do it for your entire family is probably a permanent one. Otherwise, it is going to crash and you will have to have a relapse of getting back into your older ways. Intermittent fasting is now being proposed as a very good option for somebody trying to optimize their weight and eat sensibly without starving significantly. So intermittent fasting mainly stops sugar cravings and hunger pangs, gives you more energy, lowers the triglycerides, reduces the fatty liver and the inflammation in the liver which can happen, and reduces free radical cell disease and better brain health by a process of autophagy and apoptosis. Fasting rules, we generally don't concentrate on the fasting window. I generally tend to advise time restricted eating window is very important. Make it about 10 hours. So if you're having your first meal at 10 a.m., finish off the last meal of the day by 6 p.m. So we have a 14-hour fasting window. And water-only diet for 24 hours. This is our age-old traditional methods where people in a fortnight used to have their fast where they had only liquids or water. When I mean liquids, it's not cups of coffee laden with sugar and milk. It's probably something much more sensible and less dense in calories. Exercise, again, we have to be very clear about the frequency, or say 3 to 4 times a week. Intensity. Light walking where you don't sweat at all is not counted as exercise. When you sweat and when you're not able to complete a full sentence without gasping for breath, it's considered to be a moderate activity. And the timing is usually 20 to 30 minutes. A total of 150 minutes per week, which may be increased to 200 minutes a week, is an ideal form of exercise which can be done by all adults, more so if you're menopausal and above 50. How do we manage stress? We have various methods where we indulge in mindfulness, meditation, having reading as a hobby, and various amounts of therapy can help in the cognitive aspect of stress management. How do you physically help them in stress management? Deep breathing, the pranayama, natural medicine, complementary therapies, physical exercise. Exercise itself is a very good relaxation technique, very good form of stress management. Environmental, by doing music therapy, maybe having a pet, having your spa visits and indulging and pampering yourself are environmental ways or stimuli which can help reduce the stress. Prayer, conflict resolution, first of all, coming to terms with what is reality and not being in denial will help stress management better. But for that thought process to dawn, we need to break down as to what is exactly happening and what we would like to happen. Unless we are clear on those lines, we will not be able to find an answer to what we are exactly wanting. So this is the prima facie challenge, stress management. If we are not able to introspect and think, that is when the therapist or the counselor will help us break down these components and understand what exactly causes the stress. Is it your child who is a teenager who's causing arguments, the stress, or your expectation of the child which is causing the stress? Unless you break down these components, we will not be able to manage and tackle stress in a proper way. Sleep hygiene, very, very important. We need to understand beds are for sleeping and not working. This is the problem which is dawned on with the pandemic. People use working from home. They sit on their bed with the laptop tray and they sleep there. So it is now confusing for the brain as to whether they're supposed to be awake and alert or relax and sleep. So never use your beds as a working station. Keep your bedroom quiet, dark and cooler, much more better ambient temperature. No portable electronic device used before going to sleep. Switch off your mobile if possible. I'm sure obstetrician gynecologists do not have that luxury. Try sleep and focus on meditation or imagery, which will be much more pleasant and which will be comfortable for you to sleep without agitation, and not sleep within 30 minutes of eating and having a full stomach. Ideally, a 3-hour gap window between the last meal and going to bed, which would be perfect for ensuring a good quality sleep. Rules for naps. If at all you're at luxury of having a daytime nap, a power nap is what we call between 10 to 20 minutes, improves the alertness and energy. Never wake yourself up between the 30 minutes to 1 hour, because that will cause a very groggy feeling and you will not feel very adequate sleep and you will come up with a headache. The ideal one would be 1 to 1.5 hours, if at all there is luxury. And this is mostly important for people who are retired or very elderly. Do not allow them to have a nap beyond 90 minutes because they will not be able to sleep in the night. This rejuvenates the body, makes sure that increases the capacity both emotionally as well as physically to better memory and creativity. But ideally, if you're a working person, a 20-minute nap, if at all is possible, will rejuvenate you in terms of alertness and energy. That will be desirable if possible. So why never give up? We always feel we need to give up because we have not achieved targets, but it is important for us to understand we have not even made the start. And if we make the first step, and the first 10 steps might be difficult, but 11th step becomes a habit and becomes inevitable. And if you give up, you probably will have negative effects, which will have a serious impairment and impact on your quality of life as well as your health. And you will never regret trying it till the end. And it's better to die trying than giving up. So it is very, very important to improve your positive thinking by actually addressing what is in front of you and giving it as the best try rather than focusing the result. And this is what positive psychology principles harness, engaging with your positive emotion and finding a meaning and purpose of your existence and establishing positive relationship within yourself, within your family, within your neighborhood, within your community, and within nature and environment itself. So you achieve what is best with yourself and in relation to the world. Avoidance of addictive substances. There are very clear risk factors why somebody would get addicted. So you increase the point if each parent or grandparent is having addiction. 1 point if anyone drank around you during your childhood. 1 point for each mental health use drugs around you. 1 point for each trauma you've been experiencing or if you've been abused. Beyond that, if there is readily available drugs or alcohol or smoke around you, or there is a constant environment where there is a stimulus for using these, apart from the gadgets and food I have mentioned, again, these are going to enhance your chances of getting addicted or hooked onto these substances. So this is about midlife, carry on in the postmenopausal period as well. So try alternatives to hormone therapy, try relaxation technique, eat a healthy diet, get regular exercise, avoid hot flush triggers, keep cool, have an ambient temperature, your bedroom, and avoid any bright lights within your bedroom area, which will hamper your sleep quality and hygiene. Reduce sexual discomfort by use of lubricants as well as your vaginal estrogen. Most importantly, injury prevention. Make sure you wear seat belts in the car. Fall prevention methods. Avoid any folded mats around the bathroom. Make sure the bathroom is not wet. Appropriate helmet and other safety equipment if you're on the road cycling as part of your fitness regime. Adequate number of smoke and carbon monoxide detectors. Safe storage or removal of any fire triggers, and water heater thermostat, and train household members to deliver CPR if possible for elderly people. Sexual behavior, institute prevention of sexually transmitted infections, avoid high-risk sexual behavior, and prevent unintended pregnancies, appropriate contraception, especially perimenopausally. Discontinue tobacco use, avoid excess alcohol, be aware of medication, drug, gadget, and food abuse as well. Be a promoter for yourself as well as for the family with aspects related to healthy food and exercise. So limit your fat and cholesterol intake, especially saturated fats. Maintain a proper caloric balance. Consume whenever possible whole grains, fruits, and vegetables. It's easier if you do the shopping. You will not hoard anything with tins and cans and processed foods in your grocery pantry or in your refrigerator. Ensure adequate vitamin, mineral intake, especially calcium and vitamin D, and in lines of NHS prescription. Make sure you're exposed to the outside nature at least 3 times in a week, if possible, 3 times in a month, if possible, at least once a week. That ensures good hormones in your body, especially oxytocin and serotonin, and has now become a very important dogmatic prescription in every NHS prescription related to lifestyle changes. Engage in regular networking with your friends as well as social connectedness. Thank you.
Thank you, Meera, for your wonderful talk on lifestyle modification at midlife. It was very comprehensive and it covered the whole gamut of menopause, I think. Thank you very much. And I should thank, on behalf of the chairpersons, both of us, I thank Dr. Hepzibah for having given us an opportunity to chair this wonderful session. Thank you very much.
Thank you, madam.
Thank you.
Thanks, Meera. That was an exhausting talk. And I may invite Dr. Tamil Selvi, our secretary, and
yeah.
Dr. Tamil Selvi, over to you.
Thank you, Deepa. At the outset, I would like to thank Menopause Society faculty members, society members, and Tirumanamalai OG Society for taking part in this healthy aging series. Now, the most important thing I want to place on record is this was one of the most comprehensive choice of topic.
Tamil, your okay, not good, Tamil.
It could be a half day during okay. My audio is not good?
No, it's okay.
Now it's okay. Okay, fine. Okay. So it should have been a half a day session, I feel, where all aspects of healthy aging was discussed. And I would like to thank our nutritionist who started, Ms. Anna Parvin, who started with exercise and nutrition, and which was complemented by Dr. Meera Raghavan at the end with the lifestyle measures, which was very comprehensive, looking at all the health aspects, the nutritional aspects, as well as the problems of menopause. And a panel discussion run by Dr. Premlata Madam, along with the panelists, Dr. Gita, Dr. Fatma, and Shanti Guna Singh Madam, covered all aspects of midlife. And I would like to thank all of them for their inputs. My special thanks actually goes to Hepzibah Madam to actually bringing in Ms. Yarini and Mr. Gopinath into this session. Both of them looked at different aspects of the menopause completely, and which is something which we never think about, both the financial aspect as well as the mental health. The mental health, though we talk about psychosomatic disorders, we never talk about mental health in the way Ms. Yarini actually projected, and Mr. Gopinath, who actually spoke in detail, like osteoporosis prevention starts in adolescent and elderly in the young age. So does financial planning. I hope someone has told all of this when we were young, but at least we should pass on that messages to the younger generation. Thank you, everyone. And I would like to thank all our faculty and delegates for joining in this session. Thank you. And thank you, Sheil, for actually providing the platform for hosting this series. Deepa, over to you.
Yeah.
Thanks all the team members. Over to Hepsi, madam.
Thank you. I thank each one of all the participants, Dr. Hannah, Alini, and Gopinath, and everything was very useful. Actually, the financial aspect I was thinking for a long time. So he taught us so many things. So it is very late for us. for the younger generation will be useful, like lifestyle modification and other things. The panel was in depth, and last minute on-site panelist. I mean, very, very grateful to you, and thank you so much for all your cooperation. Thank you so much. See you sometime tomorrow. I think all of us have to meet tomorrow. Thank you. Thank you so much.